Okay. But give me the power permission to share screen. Oh, yes, good, got it. Good, thank you. Have you received my email? Because I sent you email that you can spread to your colleagues. I don't hear you. I don't hear you. No. No.
Yes, something.
Yes, now okay, now it's okay.
Now?
Okay. Yes, yes. Have you received in my email?
Yes, I sent it to everyone already yesterday.
Oh, so quickly. I did it in this morning.
Ah, this morning. No, I
Yes.
haven't seen.
Oh yeah, this morning about B syndromes, because we are going to talk about the B syndrome
No,
as
I
well.
haven't seen. I was busy with we were
I
trying
understand.
to figure out the login. Yes, I see it. I'm gonna send it.
Okay.
One more thing, Dr. Soon.
Yes.
Since you've made a few changes in the document from yesterday, could you maybe please at the end of the day send the updated one? That would be lovely.
Okay. Yes, okay.
Great.
I will do that.
So, guys, everyone, I have a post-it note here on my screen, but you guys have to remind me to record.
Okay.
Because
okay.
there's no one else.
Okay.
Marlon can't do it today, and Dr. Wang is in the Congress, so.
I understand.
Okay, I'm going to open my email. I'm going to share the document now with you. Here, I see it.
Okay. Recording is started, right? You did.
Recording is started.
So you are going to be in charge of this job.
Yes, I'm in charge of the job.
Okay, okay, good. Fine. Okay. I believe everyone has received your document for today.
Just a minute, I'm still doing it.
I see.
It's giving me some problems. Just a minute. I have to close my other windows.
I see. I believe people are still arriving.
Yeah.
Okay. Are you in the second year or the third year of acupuncture, or all of you have finished acupuncture basic course?
No, we are in second year acupuncture, third year TCM.
Oh, that's wonderful.
Most of us, I think.
Still 1 year to go, or
no? This is. I mean, for me, it's my last year.
I see, and the rest.
It's my fourth year. For me, it's my fourth year.
And the rest, also the last year.
I'm actually finishing up my first year at another school, and I'm.
First year, of course, of course. And this gentleman, Dimitri.
Yes, I am in my third year of acupuncture, and I need to do 1 year of master medicine to complete the first cycle.
Okay, 1 more year.
1 more year, yes.
I see. Okay, wonderful.
Okay.
I also see another one, Chinese one. Is that Chinese one in red class? In red?
Vivian.
Oh, yes, I'm Chinese.
Liu. I saw the name is Liu. Must be Chinese, yes.
Liu, yeah. I'm also final year, same as Alet. Yeah.
Oh, everyone have good foundation. And also Beta, Pop.
Yes, this is my last year.
Oh, marvelous. So everyone is having a good foundation with TCM. Of course, the more you are going to study, the more fun and interest you are going to have. Yeah. There is still 1 more person coming.
One more second. I'm still sending. I know yesterday some people couldn't see it on the WhatsApp. For Arleti and Mariana, good advice is it's very handy for us with the studies is to download the desktop version of the WhatsApp, because that with documents and things, it's very helpful, right, guys? Who else is not here now? Shai, Mireille, Shai. So is Mariana, but she was also late yesterday, so I don't know. Well, It's after 10, I guess we need to.
So now we should start, right? Okay,
Recording is on.
good, thank you. We should continue our lesson. And we did first part yesterday, talked about etiology, pathology, diagnosis feature, and treatment features, especially that we talked about how we could use some special points and a prescription for acupuncture when we are dealing with the pain, usually include following parts. First is that causative treatment, which is very basic. Without this causative treatment, our treatment could fail. And this is the root differentiation, root difference between Chinese medicine and West medicine. So syndrome, causative treatment actually is based on syndrome differentiation. Second is that we use some symptomatic treatment, means that we use points to regulate the qi, blood circulation, and especially find the yuan point, low point, qi point from affected organ, affected channels. And then we also have the last treatment, last touch is to sedate the pain as quick as possible, to improve emotion by using the sun regulating points. Of course, we can use some ashi points, but this is all considered as the symptomatic treatment. It's not causative treatment. A local ashi point is only the points which has a capacity to regulate the qi and blood, only temporarily, and also superficially, will not resolve the problem fundamentally. However, we do need this ashi point because ashi point can relieve the pain, sedate the pain, and calm the pain as quick as possible. But meanwhile, ashi point can also serve as a guide of treatment to lead all the treatment go to certain places. So these three procedures are the way to form a prescription for acupuncture. Yesterday, we talked about how to deal with headache, how to deal with neck pain. And from these two topics, we have learned that we have to make a differentiation to see if it's acute or chronic. If it's acute, they belong to mostly due to the external invasion, except acute pain, headache, or neck pain due to some injury. So that is something not related with external invasion. But if the headache or neck pain are those complaints which is less than 3 months, mostly is due to external invasion. And the chronic pain and longer than 3 months, mostly is internal cause. For example, somebody come for headache, migraine headache, or headache related with menstruation, related with emotion. Normally, it is there for months and years. They knew that. And also, besides the acupuncture diagnosis, we also encourage people, because most of you are non-medical doctors. So to avoid any medical mistake, that you should have a clear Western diagnosis. For example, somebody come for severe headache, migraine headache, already for a couple of months, yes? And his complaint is so serious that he lost consciousness. Sometimes he's vomiting, he has lost the power of the hand, the legs. And you say, oh, it's liver young, blood stagnation, phlegm, etc. And without sending people for further investigation, then can be mistake because sometimes it can be tumor, some serious disease. Yeah. And then afterwards, people could make a complaint that you delayed treatment. And we should avoid that. And the internal headache or neck pain usually have a long history. So from duration, we can judge already it is due to external or internal, but we don't stop here. And the second step, we have to make differentiation between external and internal is that if it's external invasion, the pain usually are the pain is usually influenced or affected by weather changes. So also they cannot have some external symptoms. For example, when they stand in a windy place, they have suffer more pain, or they live in a cold place, they have more pain. And so today we are going to study B syndrome. And B syndrome is that a typical complaint that is related with the weather changes. However, not all the B syndromes, or what we call rheumatic complaint, rheumatoid complaint, are related with weather changes. How come that? Yeah, but some people have a connection to the weather changes, but some people don't. So mechanism we should understand. This is because that B syndrome is already in the second step, second level. And when the B syndrome is entering the third level, third stage, then you don't have complaints at all with connection to the weather changes. Only the B syndromes at the first stage, first level, we call the 3 B syndromes. And then they have possibility to be influenced by weather. So we are going to study the basic theories about B syndromes. It's the same for joint pain, muscle pain, which related with weather changes due to external invasion. Mostly, they are very short, and secondly, they have some symptoms related with weather changes or have some external symptoms. Of course, then we can see the tongue, we can see the pulse, we can feel the pulse. Then we make diagnosis between the external invasion and internal disorders. Internal disorders mostly is related with emotional dysfunction, and we still have to identify which emotion is playing the role for this case. Don't give an umbrella emotion to a patient that have emotion. It is impossible for TCM to deal with emotion because we have to deal emotion through the organs. Without identification of organs, we are not able to deal with emotion effectively. We could deal with the heart. However, heart is not responsible for all the organs. He is a leading organ, one of the organ, but he cannot take the function of other organs. And of course, then we have to make a detailed analysis to see which organ is mainly involved. And the internal cause for all kinds of pain also related with the diet next to the emotion. So diet should be important. And something must be wrong. Something must be wrong. Because in Westerners, a lot of people have a tendency of eating unhealthy because it's not their fault. It's not their intention to make this fault because they have never education on this topic. They thought they can eat what they want, they can eat so much as they want, they can drink so much as they want. They have no knowledge, no idea about healthy eating. So a lot of people are sick. I talked about the many people who have eaten too much carbohydrate, bread, cakes, noodles, tomatoes, etc., potatoes, I mean. So those kind of people, they thought it's healthy to eat as much as they possible. Of course, it's too much. Our spleen is not able to tolerate, to transport and transform those kind of things. Therefore, they are sick. So in this way, we also have to change their diet. Of course, their constitution, their sickness, their medications, their movement, they have over labor work, etc., are all playing roles. And nobody has a pain without reason. Say, I'm very happy, I'm very good, healthy with my diet, emotion, but still I have pain. It is not possible. So TCM tried to find out the causative factors. Meanwhile, to eliminate causative factors, give good advice to them, and also use acupuncture to regulate disorders. In most cases, shoulder pain is, or pain, for example, is relatively simple. cannot be mixture of 10 kinds of causative factors. No, it's not possible. Otherwise, people are dying. Most people come to you with one pathology or maximum 2 pathology. So we still could use acupuncture alone to solve, to help support patients. That is the advantage of Westerners, because most people, they are sick, for example, they are ill, they have a complaint about pain. However, they still are relatively simple in etiology and pathology. A lot of poor countries, for example, when you see their patient something serious, we take B syndrome as example. B syndromes usually start at the first stage. And then it moves to the second stage, it's going to tissue. Finally, it moves to the organ. But once they move to the organ, for example, they're making hard B. What is a hard B? The B syndrome is already causing dysfunction of the heart, not emotionally, functionally, but organically. Because this rheumatism factor could go with the bloodstream and circulate in the blood. Finally, they reach the valves, club in Dutch say, and then they stop there. They make inflammation. So finally, the heart is swollen, lost their function, and the valve are not able to close completely, or they have deformity. So the heart is damaged. Many people suffering from called rheumatic heart disease. That is the hard B syndromes. And also B syndrome can cause problem of the liver, can cause of the lung, can cause of the situation with the kidney. We are going to cover. And many diseases are very interesting to see. Anyway, so pain treatment is not the treatment only using some sedative points to control the pain, but we have to solve the causative factors to regulate the pain and also calm the sun. So 3 steps. We select the points, distal points, local points, and the points for preventive, usually. So, and a prescription usually is containing about 12 or 15 points. If necessary, it's only one side. Otherwise, it's a bilateral. Now we move to another topic, which is called shoulder pain. Shoulder pain. Shoulder pain could be the condition that only happens on one side, but also possible at both sides, bilateral. For example, what we call the frozen shoulder, or somebody have a rupture of the tendons, somebody who have overused shoulders, wrong movement, and in which condition that we can offer our acupuncture treatment without operation. We have to have a concept clearly in our mind. When people are not professionally sport person, sport man, sport woman, and then it is usually not urgent to have operation. But if they are, for example, they are professional sport player, and then they have to recover as quick as possible. Because a nature healing can take up to 3 to 6 months, shoulder pain, if there's rupture. Secondly, if the rupture is bigger than 3 centimeters, then we have to ask a sewing operation. So usually less than 3 centimeters, we can avoid the operation. We can avoid the operation with acupuncture, but of course it takes long, 3 to 6 months for 3 months. And also some old people, who are, for example, 80, 90, when they have the shoulder tendon ruptures, usually they are not going to have an operation. Why? Because the tendons, the muscles are becoming thinner and thinner. So if you're going to cut, operate, sew, and then the tissues are very, very thin because the protein is losing every day. And then you can cause a new rupture, new damage to the shoulders. So as long as patients are able to move a little bit, the surgeon don't want to touch the shoulder, usually. So anyway, we remember less than 3 centimeter rupture, muscle or tendons, we could manage it by means of acupuncture. Again, shoulder pain, we have to understand.
Sorry, Dr.
Yes. Yes.
Before you go on, could you actually say exactly which tendon you're referring to, just so we have a picture of the anatomy?
Oh,
Of the deltoid, you mean, or the teres, or which tendons you mean, or various?
all shoulders, all the tendons around the shoulders, usually there can be one rupture, one tear, but less than 3 centimeter, we try to ask patients, especially old people, no matter which one, of course, we have to ask patients, if possible, that we ask them to postpone the date of operation. Give me 3 months of treatment. Okay, so usually they will be satisfied. And the surgeon also will agree, except the people are suffering from pain so seriously, are not able to sleep, not able to rest and eating. Of course, then they have to opt to be operated. Mostly old people, non-sport persons could wait. But of course, you ask me which tendon. Okay, again, TCM never talked about the specific tendons. Okay, they talk about the meridians. For example, and biceps. Okay, the muscles. The other tendons. Yeah, but if people who have the report echo showing that it's certain tendons rupture, tears. But then TCM always look at the meridian, which meridian it is involving. Therefore, afterwards, we can see that in here, we have to see which point here is that point selection from the affected channels. Without this step, you will fail with acupuncture treatment for shoulder pain. Not possible. You use lightness 4, level 3, split 6, it's nonsense. It's cheating. It's not serious. It's not scientific. It's not responsible. We cannot do that. We must be a serious person practicing professions for patients. It's not because that you put the needle in and then you can expect a result. It's nonsense. But if we only selected some points from some affected channels without differentiation, syndrome differentiation, without our procedures, it is also not serious, non-scientific. Also, it's rubbish. Yeah. Of course, now we're going to talk about what are the causes for external invasion. Usually, if it's less than 3 months, it is called external invasion. But external invasion, when we are going to study B syndrome, we could see that actually we have to make a differentiation between wind, cold, damp. Usually, wind, cold, damp, these 3 pathogenic factors are at the same moment invading people. But still, there is some difference between the predominance of one of these 3 factors. Yeah, must be one is predominant, not equal, 33% of each pathogenic factors. Normally not. Because everybody is different. You have more wind, you have more cold, you have more damp. For example, the damp person mostly is the person who can attract the invasion of damp predominantly. The older people, weak people, vegetarian people, for example, they can often attract the cold invasion. The liver person, stressed person, they can often attract the invasion of a wind. Fine. So we have to understand if it's acute, it's external invasion mostly, except it is due to wrong movement, injury, hit by the car, falling down from the height during the trauma, etc., which is neck broken, neck injured, etc. Mostly is if there's no trauma or wrong movement, it is due to external invasion. We take example. We take a frozen shoulder as example. Majority of the cases are due to the chronic one, chronic cases, due to qi blood stagnation. Sometimes there's only qi stagnation. It's light, superficial. But once it is a frozen shoulder with stiffness, stabbing pain, it's already in the level of blood stagnation. Of course, in classical medicine, you could see that by CT scanner, by the MRI, you can see there's degeneration, there's calcification, etc., etc. A lot of explanation. But in TCM, there's mostly two possibilities: external invasion and qi blood stagnation. And especially blood stagnation is a major cause. External invasion usually are due to the person who sleeping with the window open and with the blood body without taking pyjama, and with the door open, that is draft of wind blowing to the sleeping rooms, etc. Must be some reasons. Or sleeping in the area which is humid, not dry enough, without central heating, etc., etc. So external invasion. The typical symptoms of external invasion is that local sensitivity to wind, cold, damp, local. And weather changes can make an aggravation of the pain. And also people could have some external invasion symptoms. For example, when they forget to put clothes on, or sit somewhere with a wind, or cold, or damp, they can have more pain. So this is quite clear evidence. This kind of a shoulder pain is caused by invasion of wind, cold, damp. When there is an invasion of wind, cold, damp, our main task in any case is to eliminate wind, relieve cold, and also resolve damp. And so here we have the list. Here, causative treatment. Causative treatment are fixed, not only for shoulder pain, neck pain, for all kinds of pain, for all kinds of external invasion, for sinusitis, for headache, neck pain, for hip pain, etc. The reason is because when external invasion happens, the pathogenic factors are still staying at the superficial layer of the body. Therefore, to promote sweating, to regulate the lung in dispersing function is enough. Here, yesterday we explained the points we used: Latin 4, Sanjiao 5, triple burn 5, lung 7, blood 7, 12, are all the points, are base points for external invasion. They include for wind heat, wind cold, wind damp, wind dryness. Because the purpose of using these 4 points are very simple. Just to make the lung to disperse qi, make the superficial layer of the body to make sweating. Of course, if there is a difference with wind, cold, or damp, and we have to make some efforts. For example, moxibustion is used especially when the cold is predominant. Of course, if there's a wind is predominant, say I have shoulder pain, right shoulder pain, because the last 2 months is sensitive. I slept somewhere and with the window not closed, etc., etc. So I have sensitivity to wind changes. Fear especially worse by wind. So indeed, in this case, we have to relieve the wind. So the points here, we're not able to relieve the wind strongly, efficiently. So we add some point for relieve the wind, for example. Leaf 3, Goblet 34. Also reducing method. Reducing method. Always TCM emphasized the importance of needle technique. When you put needle in without manipulation, without the tonification of sedating, your effect will be limited. Therefore, we have to use some techniques to reduce, for most cases, the external invasion. So here is for mainly for wind. But if it's cold, we use moxa, right? Oh, so cold. For cold. For damp, the points we use here, are they enough for damp? No, no. They make sweating, yes. They regulate sanjar, triple burn, yes. They regulate lung, it's okay. Because external invasion it often is combined with running nose, throat sensitivity, etc. phlegm. So here we have to add some extra point to relieve damp. For example, sanjar 6. Sanjar 6. Sanjar 6. To relieve damp. Stomach 40. Or spleen 9. Also reducing method for damp. Very clear, very clear. Step by step. In most cases, when people have invasion of damp, you will see people can have a heaviness of the shoulder, but meanwhile you will see their spleen and stomach are often involved. For example, appetite not so good, loose stool, heaviness of the muscles, and usually invasion of damp happens to those persons who are a little bit heavy, who are not careful about their diet. Sweet, salt, raw materials too much. That's all. That's all. Not yet finished. This is causative treatment for external invasion. We have to move to next. Is that people have a chronic case. Most cases who come to you, 80–90% are the chronic cases. Seldom people say, yesterday I drove a car, I have a cold, I caught cold, and then I have shoulder pain. Not so many, because they can tolerate. And most people, they can take some painkillers, they can take rest, put more clothes on, for example, to improve their symptoms. But the case you could see you have in practice mostly is due to chi blood stagnation. Chi blood stagnation. Chi blood stagnation can be the case they have a chi stagnation and blood at the same moment, but also possible to see only they have chi stagnation. Chi stagnation. However, blood stagnation is a major difficult case. Rupture, chronic arthrosis, degeneration, and compressing of the vertebra, compressing of the scapular regions, and etc. of trauma, operation, and this and that. Mostly is due to plasticness. And also, for example, calcification on the tendons, in the muscles, calcification is also usually due to plasticnation. Why? How do we know plasticnation? By investigating. First of all, it is that it is long history. Long history. How long it is? Usually more than 3 months. 3 months. Don't underestimate frozen shoulder. When they come to you, they will complain, yeah, after 1 or 2 treatments, it's still not better. You have to explain. This is a disease, could have a self-improvement without treatment, but it takes at least minimum 1 year. Without treatment, 1 year. We call it self-healing process. It is possible without treatment. But with treatment, you can speed up the procedure of recovery. Instead of 1 year, you can, for example, 3 months, 6 months, because it's already shortened the duration. Yeah. And meanwhile, is that also you can improve the accompanying symptoms. For example, usually people have difficult to move and have a lot of pain, wake up. But after treatment, the sleeping could be improved, movement could be improved, etc. So acupuncture is still, scientifically speaking, effective. It is not same like the painkillers. Painkillers were not able to control the inflammation. Even they give corticosteroid shots, or they take anti-inflammation pills. Mostly they don't work. They don't work. Now, so-called scientific research in modern medicine has its advantage and disadvantage. Advantage is that they have proof scientifically to show how the painkillers, anti-inflammation pills, corticosteroid drugs, injections could improve the pain. They could show that. But in reality, it is limited. Because if it works, then TCM has no market anymore. There's no market, because if you have pain, frozen shoulder, you go to the kinesist, you go to the house doctor, take some painkillers, anti-inflammation pills, and then why should acupuncture exist? Because it's expensive, it's inconvenient, it's not completely paid by the insurance, etc. It means that there is still a big market for acupuncture existing. It will not diminish in 10 years, 100 years, maybe in few hundred years. But in that moment, I believe TCM is also improving its technology a lot. So we come back. Plasticnation first is a long history, more than 3 months or few months, even up to a few years. Second is that they have also stabbing pain. The pain is not distending pain, sharp pain. Usually it's stabbing pain. And this stabbing pain is drive people crazy because it's a lot. And it is usually accompanied by the fixed location. Fixed location. When plasticnation is there, place is fixed. So they can tell you one point, one channel, one area is suffering from pain. And also not moving from left to right, up and down, no, only one place. They can exactly tell where it is, And then it's worse was at night. Usually blood stagnation was at night. Why? Because at night is a yin. Everything is slowed down. And the blood stagnation is yin. And also there is a slow, very slow movement. During the night is again more slowed movement. Of course, the situation blood stagnation is getting worse. Mostly this is already sign blood stagnation. Local swelling, local swelling. So people can tell you that there is a protrusion, local swelling, which is obvious than other part of the shoulder. Of course, then tongue and pulse. Tongue pulse are not always the case, could be identified, discovered. Why? Because if there's blood stagnation, it is at the local area, local places, not the general body. But the tongue and pulse condition are only reflecting the general body conditions. So if blood stagnation happens on the large intestine, don't expect that there must be purplish tongue, must be choppy pulse, unsmooth pulse. It is not possible. It is possible, but not always the case. Always case. So don't expect that there must be a tongue or pulse changes. For example, some people have a phlegm in the lung, only phlegm in the lung. So not always possible, not always that you can see greasy coating, slippery pulse, for example. Of course, those three symptoms are the vivid demonstration of blood stagnation. But don't expect they will appear at the same moment all the time. It is possible one or two or three of them. Of course, the more symptoms from these 6 listed manifestations, the more accuracy of the diagnosis of blood stagnation. But of course, then patient has suffered a lot of pain because blood stagnation is quite serious. Usually, local fixed location, stabbing pain, or lung history are sufficient to diagnosis as a blood stagnation. Somebody have a history of a trauma, wrong movement. Somebody have a history of a shoulder joint, etc. Blood stagnation is quite easy. When blood stagnation happens, we have to take procedures, method, points to promote blood circulation. Don't use the points to eliminate pathogenic factors. We have to use some method to relieve the external invasion. Here is not relieve the external invasion, to promote blood circulation. Here are the points. So those points are used for blood circulation in general body. Don't forget that. In all parts of the body. All parts of the body. Not only blood stagnation in the heart, in the shoulder, in the neck, in the head sectors. Why? Because this is the group of points to promote blood circulation. Meanwhile, we promote the blood chi circulation. So here, the red one are the one to promote blood circulation. Induce the circulation of blood be more smooth. And we also don't forget, blood circulation could be promoted by chi circulation. Therefore, we use here, we use here, these 2 points to make blood circulation better, And also, leaf 3 and large leaf 4 are the good combination to sedate the pain. Are they enough? No. Very good suggestion, But if you answered in this way in the examination, say how to manage the pain, shoulder pain on the right side because of blood circulation, your diagnosis is correct, your point are listed, I will give you 5 on 10, or even 4 on 10. Why? Because you forgot that this is causative treatment. You have forgotten the symptomatic treatment. You forgot. So next step is that you have to move to the symptomatic treatment. Symptomatic treatment is the point is that you are going to lead to the place where people are suffering from injury, rupture, calcification, inflammation, etc., etc. Usually, shoulder pain are involved by 4 channels. So heart channel, pericardial channel, etc. are not so often involved, except people have the shoulder pain under the oxals. Under the oxals, most of these pain people have the shoulder pain is on top of the shoulder, not under the shoulder, under the armpit. Yeah, so it's different. Channels should be differentiated. Here we have listed 4 channels which could be involved. One is the lung channel, another is 3 yang channels. In most cases, 80 or 90% of the cases, only 1 channel is involved. Only 1 channel. From one of these 4 channels we have listed. Lung channel, for example, large intestine channel, and sometimes triple burn, sometimes small intestine. It is also possible all the 4 channels are involved in severe cases. In the cases with a lung history, for example, people who have a frozen shoulder for many years, frozen shoulder who has undergone the operation. So in any case, we should not worry, not be panicked. We look one by one. How do we know? Asking the history of the patient and palpate the channels to discover, is there any abnormal changes along the certain channels. For instance, people complain mainly have the pain, for example, going backwards, okay? Going backwards mostly is the channel of the lung. Sometimes large intestine channels are involved. So here is inflamed or injured. Then you have to palpate to see, is there any abnormal changes such as nodulation, swelling, some depression, some color changes, some abnormal skin protrusions, pigmentations. So any abnormal changes could reflect this channel has something wrong. And at this spot, and then it is important, we see that it is usually the case, that's blockage. How do we start? If we found that there is some changes of the channels disturbance? We are going to use some special points. Which points we should use? You use some points which can local points, yuan point, low points, Shiklev points. Okay, so I here mostly is local points. Local points. Xi point, low points, yuan points. Can we use some C points? Yeah, C points. Usually not, because C points is usually for internal organs. Internal organs. If people, of course, has some lung disorders, meanwhile they have also internal organs complaint of the lung. So in this case, we can, for example, use some C points. Usually, not necessary, because we have sufficient good points which can regulate the channels. Now, here, for example, Jianqian is actual meridians, actual points. So which is Wenchun above the front auxiliary fold. Do you know that the auxiliary fold, you have crisis. Wenchun above this crisis, that is a Jianqian. Jian means shoulder. Qian is front. It means it's at the front of the shoulder, which is at the large lung meridian. Meanwhile, we use large lungs 3, lung 4. Why? Because they belong to the local points. Okay. And also, in severe cases, when the lung internal organs, people have a COPD, people have a cough, people have because people have, say, a lot of emotions, then lung 5 is used. For example, when lung channels is involved, especially chronic cases, you will see that those kind of patients are suffering from emotions, especially is sadness. Yeah. If people have a complaint of sadness due to different reasons, yeah, we try to persuade them, help them, assist them. Meanwhile, we can use some point to regulate the emotions of the joints of this lung. So lung 5 is regulating the C organ, but also we have for example, some good point to relieve the situation of the emotions for the sadness. Do you remember? We use, for example, lung 1 is also good. Bladder, lung 1, bladder 13, even bladder 42. They're all very good. Now, to relieve especially the emotion of sadness, for the sadness, relief. Without adding those 3-4 points, you are not able to relieve the sadness effectively. You can use hard, for example, Dumai 11, hard 44, blood 44, blood 15, etc. It's a plus point, but not able to solve the sadness directly and deeply, fundamentally. Yeah. Like that Ministry of Agriculture has some trouble. Instead of trying to help this Ministry of Agriculture, you went to the king. You asked the king to solve it. Of course, king can solve the agriculture problem. However, if the Ministry of Agriculture is willing to cooperate with you, with the help of the king, could be much better. But don't force your king to solve the problem in the Ministry of Health, Ministry of Agriculture. So here is the same hatred. We use lung 5. We have 4 points, 3 points, 4 points. Very good point to improve the emotions. This is the way I told you. Acupuncture is much more effective than herb medicine. Herb medicine, they don't have so much possibility at this moment now, because of the limitation of the herbs. Acupuncture will. Secondly, is that acupuncture works for spiritual level, and it has good effect. So don't forget, if it's a lung channel, and if it's only due to phlegm, due to chi stagnation, due to emotions, you have to solve the fundamental problem. Meanwhile, regulate the lung channels by using the lower point, yuan point, and also Shiklet points. Do you remember the Shiklet point of the lung, which it is lung 6, right? Okay, low point is lung 7. Lung 7 is already used from above, right? So, but here also it is very good for the low point. Yuan point is lung 9. So by adding the points, a few points like this, your power, your way of treatment is much stronger. It's stronger. Yeah. Okay, then we also add some points for emotions. But suppose this person has shoulder pain, but meanwhile also lung qi weakness, lung yin weakness, phlegm accumulation in the lung. It's not by coincidence that people only have the meridian complaint. Can also people have a different pathology in the lung. Okay. Okay. Combine with the basic points for the, okay. Oh, good. Lung organ. I mean that if people have a lung qi deficiency, lung phlegm heat in the lung, or the people have the people have the cold phlegm in the lung, you have to also treat. Usually, shoulder pain is not always, but sometimes related with lung organ disorders. Because in acupuncture, we have two systems. One is meridian system, another is organ system. And this organ system and the meridian system could have influence of each other. Sometimes both are sick, but sometimes can be sick only from organ or only sick from the meridians. Luckily, if it's only sickness in the meridian, it is not necessary to regulate the organ deeply, right? But if the organ also is sick, the channel is also sick, has disorders, you have to regulate these two organs and the meridians at the same moment. For example, this person is COPD. COPD is a disease that quite common in Westers. Now getting lesser. Some people can die of it because of smoke, heavy smoke, pollution. People have also worked in the dust factories for many years. COPD. Okay. Chronic obstructive pulmonary disease. Do you know this disease? It's awful, awful. So if people have shoulder pain along the lung meridian, and then you can see that you have to solve the liver problems as well. TCM is interesting. However, TCM is not easy. In this case, you have to also do your best to manage the COPD. As I mentioned, if there's phlegm, you have to solve phlegm as well. So the points are the basic points. But here, don't worry, don't make exaggeration. People are coming not for COPD, people are coming for shoulder pain. So the main complaint, main disease they want to solve it, help them is the shoulder pain. So the points we have listed are the main points for shoulder pain. This is the lung channel. When the large intestine channel is involved, again, it is not correct that you are going to use points from the lung channel, from the spleen channel, from here and that channels, right? You have to use the lung channel, some local places, for example, 14, 15 points, large intestine 14, 15, even 16, for example, they are all local points. Large intestine 16. Very good. But don't forget here, don't stop here. And then we continue. We use 6, 7 secret point, low points. And we also use the point large intestine 3. Do you remember large intestine 3, what point it is? It is shoestring point, because it is a shoestring point. Shoestring point. Remember yesterday I talked about the shoestring point. They could be used for situation of the joint complaints. Joint complaint belong to the shoestring point. So it leads the treatment, harmonize, benefit the joint of large intestine. And here, there's also shoestring point. Indeed, we regulate the pain, harmonize the pain, and also we induce the treatment going to the shoulder joint. Also local points. So it's sufficient. Local cupping, local moxa, they are fine, they are wonderful. They are wonderful, wonderful. And also, do you still remember? If it is the case that they have complaint of large intestine, constipation, diarrhea, abdominal pain, those points are also helpful, but not enough. Not enough. You have to ask them, do they have any complaint of large intestine to see if it is correct. Usually, if it's, for example, they have disorder of large intestine, for example, cramp, diarrhea, constipation. So some points should be used to treat the low C point, for example, large intestine 11. It's low C point, low C, her C point, her C point, her C point. And meanwhile, you can see, for example, stomach 25, eventually bladder 25. Why? Because one is front move point of large intestine, another is back through point of the large intestine. In severe cases, you can use, for example, to my sleep, for large intestine, to my sleep. Now you are getting more and more wiser, clever, touching the point to treat the shoulder pain. But a lot of the cases, majority of the cases, they don't need to touch the internal organ. Seldom people who really are coming with shoulder pain due to internal disturbance. Most is only local channel disturbance. Channel disturbance. Now, triple burner. Triple burner, when it is involved, again, we use some local points. Local points. You can use even, again, triple burner 16. They're all local points. and then 7 or 8, for example, 4 yuan point, 7 low point. Low point already used, okay. Is a 4 point yuan point, okay. A Shiklev point plus the local points, right? Also can use, for example, 13. They're wonderful points, the local points. And then it's yuan point, Shiklev points, plus the point we have already used, 5, for example, for external invasion. Do you remember? Here, 5. But if it's not due to external invasion, it's due to the internal disorders, we can use 5 here. Anyway, we add because it's the low points. Low point. Another technique. When you see the large intestine, triple burner, small intestine, do you remember yesterday we talked about the low C point? Lower C point. Okay, low C point. It means that all the 6 full organs has its connection point nearby the knees. Each of these 6 full organs has one. If the large intestine is involved, besides we can use bladder 25, stomach 25, large intestine 4. But we still can use another low C point, which is stomach 37. So advantage of use stomach 37 is that we puncture our this point. Meanwhile, ask patient to move the shoulder. It is working very well. Moving very well. For chronic shoulder pain, and also we can use low C point from affected the channel. Another way is way of symptomatically.
What about stomach 38 for the shoulder?
Yes, that's why. I'm talking. Okay. Okay. Symptomatically, if we use goblet 34 with stomach 40, so somebody, or it's also possible stomach 38. It's the same. In this way, from the same side. So we can ask patients to move, after puncture of the points, only 2 points. And then we ask patient to move the shoulder for maybe 10 minutes, 15 minutes. And then further on, we put the needles on the different channels. This is but symptomatically, but we have to understand why this mechanism is used. Why we use this mechanism? Can we use it for acute? Normally not. It is only for chronic cases, because goblet 38 is the gathering point, meeting point, confluence point, influence point of the tendons. One of the 8 gathering points. So shoulder, people have shoulder pain. Could be muscle pain, but most is due to tendons inflammation, rupture, tearing, or inflammation, or degeneration, etc. So this is leading to the tendons relaxation. Stomach 40 is the point specifically to resolve phlegm. Chronic cases, most is due to blood stagnation, but also another factor is existing, which is phlegm. So this stomach 40 or stomach 38, choose one of them is sufficient. We can take the same side and meanwhile ask patient to move. Now we have different methods. Acupuncture is not only put a needle at fixed places. We have different possibility. For example, you want to eat vegetable in the morning, in the midday. But we have different choice of vegetables. There is some slight difference between vegetables. Mostly, they're very good for health. So we have a different method, different possibility to help patients. Yesterday, I mentioned the more technique you have learned, the more possibility you are going to open the door for patients. There's more chance to improve the pain immediately during the treatment. Okay. So suppose you only have done the level 4, level 3, spring 6. What is that? What is that? It's nonsense. It's not serious. It's not scientific. We come back to the small intestine. Small intestine is the case that we have the situation that we can use also local places. But small intestine is much longer than large intestine, longer than tuber burner. So because the scapular region, the upper backside is included. Therefore, we use a lot of local points. If people don't have so much scapular pain, we're lucky, only shoulder. But mostly, in most cases, the shoulder pain has a huge involvement, big area involvement. So we also use the shoestring point, why? Induced to the joint, right? And also we use the yuan point. You use the Shiklet point, right? To relieve the pain, local pain. And also we use, for example, 38, stomach 38 as a low C point, etc. Fine. It is possible that when people have shoulder pain, more than 2 channels are involved at the same moment. For example, large intestine together with small intestine. Lung channel with tuber burner. Lung channel with small intestine. So no worry. Don't be panicked. You have to use point line by line, point by point. No worry. The next step after first step is cosmetic treatment. Then the channel treatment. Then move to the sun coming. A lot of people who have so much pain because it's chronic blood stagnation, so it can be serious pain. So we have different points to calm the sun, hard 7, hard 3, blood 15, etc. 2 points should be enough. 2 points. Interesting enough, if you have the chance, just puncture the points to calm the sun as a first to see if they are working or not, and then usually they are working. And the pain could be diminishing immediately. One or 2 local points as Ashi points can also be used. Okay. Horizontal point selection. It's very interesting. So when people who have shoulder pain, do you still remember which part from our body is connected to our shoulder, our hip? So we selected the same meridian. The meridian has the same name, and try to find around our hip, and then puncture the point as symptomatic treatment. Now you will find amazing. Good. Normally, we should take a break in the morning for 20 minutes, but I would suggest to take a break for 10 minutes. So afterwards, we take another 10 minutes for break. Is it okay? Fine. So I will
Yeah,
see
whatever
you,
you want.
I will see you in 10 minutes. Is it okay? Yeah.
Yeah.
Okay.
Guys,
I'll see you.
yes. I'm pausing the recording, so please remind me when we get back.
Yes. Thank you.
Okay.
10 minutes. Yes.
Bye.
Okay. But you do need some acupuncture in combination with moxa. We have a different way to use moxa. We can use moxa cigar, moxa on the needles, ginger and salt, moxas, etc. But direct moxa, I mean the moxa on the joints is the one of the best one, best effective therapy. Moxa on the needles also it is good. It's indirect moxa.
Okay, but it's not clear to me when you say getting rid of coldness for shoulder pain, you would only use moxa on the points, on the long points for coldness?
No,
Or-
you have to do some points, basic points, largest 4, long 7, triple 5,
Okay.
and then also you use moxa. Moxa you can choose, for example, largest 4 and largest 14, largest 15. If it's on the large intestinal meridian, for example, extra meridian Jian, lung 3, lung 5. With moxa, if it's a lung meridian involved. So moxa together with acupuncture is the marvelous combination.
Okay, that wasn't clear. Thank you.
Okay, great. Fine. Any other questions? Good. Otherwise, we continue. Next topic is elbow pain. When talking about elbow pain, most cases we often hear is that the people have a tennis elbow or golf elbow. The difference is that only involvement of meridians. Yeah, it is usually a light case, much more less complicated than shoulder pain, because shoulder pain can involve the different meridians, a long meridian, largeness meridian, different 3 young meridian. But elbow meridian, much simple. The causal factors are almost the same. But the one factor is true that when people who have external wind cold invasion, and when they arrive in your practice, they have almost no external invasion symptoms. How can we explain this situation? So afterwards, I will explain this in B syndromes, because this is already called tendon B. The second level already is reached. It is not a superficial B. So the epicondylitis is the explanation why people have a tennis elbow. In most cases, if we understand that they're overused by playing golf, by playing tennis, by labor working in a factory, working in a garden, some they cut something seriously, heavily, etc. But at that moment, during their work, there is sweating. So the sweating is a one nature physiological phenomena to eliminate wind, cold, damp, to release the heat, internal heat. However, it is just a moment that during working, the skin pores are open. with overworking, over-labor exertion, the tennis elbow, this place is exposed to the nature. So the pathogenic factors came into the elbow without you notice. Probably you feel a little bit cold, but you never pay attention. Why? Because it is far from our heart. Our sin is not able to notice it. For example, if you put a hand in the cold water, say, oh yeah, it's cold, yeah. But you never have a clear thought saying, oh, this is cold, I should not touch it. But already you often contact this cold water. You expose your hand, your elbow, often in the wind, but you don't notice because it is the location relatively far from the heart. If it's from shoulder, it's from the neck, from the chest, back, they are close, relatively speaking, closer to the heart. So you are aware of this kind of the invasion, but the tennis elbow or golf elbow are exception. When the external invasions happens, you don't have so much pain or slight pain at the elbow, but you never come to acupuncturist for complaint, for improvement, for treatment. Until the moment that your elbow is suffering, not able to extend, flexible, move. During sleeping, you are weak of the pain. You are not able to hold up something to open the bottom or to open something heavy. You cannot carry a glass of water. And then you start to realize something wrong with my elbow. Then they discover, oh yeah, it is tennis elbow or it's golf elbow. The reason that you don't realize is because it's far from the heart. Secondly, is that it is already after a couple of weeks and the pathogenic factors enter to the second level, tissue level. Therefore, it is possible that you are still sensitive to weather changes, wind, cold, damp, but also not so much. Therefore, we can go back the history when you have the tennis elbow. For example, you have to ask them, have you done something heavy? Did you sweat a lot? And how was you feeling that moment? Mostly they will tell you, yes, that moment I sweat a lot, I used my elbow a lot, etc., etc. But anyway, external wind, cold, damp invasion is a chief cause. It is B syndromes. Already B syndromes at the second level, tissue level, tendon B. So we now already told you it is tendon B. It is second step. So we have to continuously eliminate wind, cold, damp, and meanwhile to regulate the tendon, especially tendon at the large intestine, because tennis elbow is the only channel to be involved is the large intestine. Sometimes small intestine, sometimes triple burner, but they are not the main channel to be involved. So large intestine channel is the chief channel to be involved, remember. When tennis elbow is lasting for a long time, more than 3 months, then you will see blood stagnation started. So not anymore sensitive to weather changes or slight. But the main complaint is that the local blood stagnation, stabbing pain, stiffness, and also worse at night, fixed location, as the symptoms I mentioned already. Because it is such a local blood stagnation, it is not possible to always show there is a choppy pulse, published tongue, you can see on the general condition. Not possible. It is possible, but not always the possibility. So we have two types of tennis elbow. Acute belong to less than 3 months, belong to wind cold damp. Longer than 3 months is called cheap blood stagnation. And also we have to understand if the blood stagnation, the treatment takes a little bit longer, 5-6 times, 5-6 weeks treatment, wind cold damp shorter, much shorter. 1 or 3 time treatment normally should be enough because you eliminate pathogenic factors, harmonize the collaterals, the tendons, it is solved. Causative treatment, tennis elbow. We have to use to, again, same points, right? Here is okay, same points, like we mentioned above for the shoulder pain, right? No special difference. I told you, not only for shoulder pain, neck pain, tennis elbow, for all kinds of pain, if it's due to external inflammation, we use this. We use this to eliminate wind, cold, damp. If it's wind is there, cold there, damp is there, we use some extra points. Extra points. Is that enough? No, not enough. So here again is that the second step is that here we have to use some different channel differentiations. I mean, use some points according to the involvement of different channels. Here, the most important is that we use large intestine. Here is colored, highlighted in yellow. We use again large intestine 3 is because it's the yuan source, the shoestring point leading to the joint. Meanwhile, we use luo, yuan, xi, luo points to regulate the large intestine. But the local point should be added, such as short pause. Large intestine 10, large intestine 11, large intestine 12 sections. So this way, we lead the effect to the local areas. Without the large intestine, the local points, the treatment is not enough. Okay, meanwhile, we also can use the third step, local ashi point, 1 or 2 ashi points. 1 or 2 ashi point is, we have a system called surrounding technique, such as surrounding technique, needle technique. What is a surrounding needle technique? Is the system that we have chosen epicondyle tendon, and we take that as diameter, as a center, and then we use 0.22 times 25 needles. We make circulation make a cycle around the epicond, make a cycle by using the points. So the needle are superficially inserted. We take with about 4 to 5 needles. Okay, so that means the needle are superficially punctured, and it should be done anti-clockwise. anti-clockwise. So it's not clockwise. Anti-clockwise, it means that it's anti-clockwise. Anti-clockwise means reducing method. It's not circulating. So around the epicone, we put 4 needles, 5 needles superficially, forming about 15 degrees, put insert needle. And then making these cycles, it means blockage. So when during the war, you are fighting with enemies. So you try to isolate this group of animals and enemies by using the circles. TCM is also doing the same in reality for acupuncture.
Professor?
Yes.
Do you mean we insert the needles in an anti-clockwise order, or we manipulate the needles?
No. Anti-clockwise is insert needle, 4 or 5 needles.
Thank you.
The manipulating is reducing method. Here used reduced method is used anti-clockwise and more lifting than thrusting. This is the here is only the insertion way, surrounding way, anti-clockwise. So this is a technique can be used.
What's the reason for the anti-clockwise?
Reducing.
Yeah, but energetically, what's the reason putting in needles anti-clockwise as opposed to clockwise?
Have you studied what is a technical for what is reducing, what is tonifying? Have you studied?
In terms of working the needles, I've only studied how to tonify and disperse, but not anti-clockwise, no.
How many methods have you studied, tonifying or reducing? Because you are coming from a different schools. I believe the other people there have learned this already. You are the exception. You only have learned one technique.
I've only learned 2 needle techniques.
I see. Normally there's 6 techniques. 6 techniques. For example, lifting, thrusting, right? This you have learned, right? Heavily lifting, gently thrusting is reducing.
Yeah.
Heavily thrusting, gently lifting is tonifying, right? This is number 1. And then clockwise turning heavily, anti-clockwise turning gently. This is tonifying.
Okay.
Anti-clockwise heavily, gently clockwise is reducing. The second way. And then is with the needle, when you take needle out with needle, the holes open, or you close it. When you close it quickly, close it is tonifying. When you take needle slowly, gently, make the holes open, which is reducing. Have you learned that?
I've only learned the needle manipulation, the first 2, which is tonification.
No, okay. You can search tonifying and reducing needle techniques. 6 techniques.
Thank you very much.
So this anti-clockwise is one of them. So also following the direction of the needle, following the direction of the channel, or against the direction of the channel, against is reducing. Following is tonifying. Have you learned that?
I only learned when you insert the needle quickly and then take it out slowly. That's for tonification.
Oh, no.
Yeah.
You have talking opposite.
Okay.
Okay, opposite. You are talking reducing because you leave the open over the holes.
No, you keep the what I was taught is you put in the needle in quickly,
No, put needle slowly.
Slowly.
Take needle out quickly. This is a tonifying.
Yeah.
Okay. And
Yeah.
also have you learned also how to put the needle in when people are breathing in, breathing out, breathing? You haven't
Yeah.
learned.
But I'm not very good at
I see. Just
puncturing,
read
but
it.
yeah.
Just read it. Okay. I believe rest of the class colleagues, classmates have learned this. But repeat, repeat. Because this is the technique we have to practice every day. Good. So that's why we put the anti-clockwise, the cycle, because this is reducing. So we have a different technique already learned to solve the external wind cold damp. I must tell you, most people who have the external invasion and then can be quickly solved. Now move to next is that blood stagnation. Blood stagnation is the case that they have a chronic pain, worse at night, lack of force, stabbing pain, fixed location. They even had operation previously or recent operation, but still pain. They have infiltration, shots of corticosteroids, still doesn't help. So again, what we have learned already, blood circulation. Again, chi circulation. That's all. But we are not finished. We're not finished. Oh, wait. Okay. We have to move to the meridians. If we take, for example, it's at the large intestine, then we have combined this large intestine channel again. Only in this way, we specifically move blood circulation in the large intestine channels. Without adding these points, you cannot expect that you are going to improve the tennis elbow. Not helpful. Because at this job, you are promoting blood circulation in general body. But people do not come for general body blood circulation. Not everywhere pain. They come specifically for the tennis elbow. Okay. In this case, if this combination is down, immediately blood circulation is guided to the large intestine, not somewhere else. Not going to heart, not going to the lung. It's only going to the large intestine. Wonderful, marvelous. Here you don't need to go to the large intestine 14, 15, 16, etc. Right? But in that case, also ask, how is about your stools? Constipation, diarrhea, cramp, regularity of stool or not? You say, that's true. Last month or recently, I have a really big problem of intestine. I cannot go to big toilet or have diarrhea. I have this and that. Okay, continue to work with the points to regulate large intestine, as we mentioned already. Do you remember for the shoulder pain? Here. Okay. So, for example, we use large intestine. We use stomach 25, bladder 25, GB3, etc. For case that have troubles with large intestine. We can use also stomach 37 as well, etc. Right? Clear. So people must be smart. Don't forget only using the local points. Forget to use the points to regulate the organ itself. Okay, that is large intestine. But in some cases, large intestine is involved together with another channel, which is that triple burn. A triple burn.
Oh.
When triple burn is involved, a little bit, not very much, a little bit. So large intestine channel is mainly involved. Triple burn is partially involved. We will use triple 4, for example, 7, 3, for example, triple 4 also. 7 is the secret point, yuan point, and also local points. You will see 1 or 2 points is sufficient. But if this case is complaining that they have a tennis elbow pain, mainly due to the triple burner, but then you don't need to touch large nesting. Don't touch large nesting. Yes, but 90% of the cases is due to large intestine channel alone. 90 cases, 90%. Do you remember when they say also you have to ask beside this local area by you discovered it by preparation, you also have to try to see if they have the triple burn organ problem. For example, they have phlegm, they have a water retention, difficult urination, right? Do you remember which is the low C point of the triple burner? We have to regulate.
39. Bladder 39.
39, right? Very good. Good foundation. Oh, marvelous. What is the backshore point of the triple burner?
22.
22.
Bladder 22.
22, yes. 22. 1 level above. And at Dumai, 5. It is a good point for triple burner. So we have different possibility for regulation of triple burner. Bladder 39, 39, and backshore, and we have a GV5, etc. We have different possibility. So in this case, wait.
Do you mean Renmai 5 or Do 5?
Dumai.
Dumai.
GV is Dumai. Governor vessels. Mm.
Because Renmai 5 is the front move of the Sanjiang.
Yes, also good. Also Renmai 5, also good one. Front move point. Also, we have a different possibility. And one day, for example, there's an old man suddenly arrived. He arrived always for natal laws, urticaria. But one of the time, suddenly arrived with complaint of difficulty in urination. Said, in the last few days, I have very difficulty to urination, and slight pain. That the urine doesn't come out easily. Something wrong. And meanwhile, has pain on the right, the left side. I remember left side, the low back radiating to the inguinal regions. And this is a typical cases that there's a formation of stones. Stone formation in the ureter, in the bladder. But in TCM, it is considered as disturbance of the diaphragm because pain in the lower back radiating to the inguinal region. So, of course, when he arrived at the practice, he wanted to go to toilet. Difficult, almost so difficult that is dropping. So after regulation of the diaphragm, so here this is evidence, vivid evidence of how important it is to make differentiation, meridian differentiation, syndrome differentiation. So involvement of the diamide, disturbance of the diamide. Do you remember extra meridians? To open extra meridians, yesterday we talked about 4 group of points, right? Okay, so here, should we use 115 and goblets 41 or other way around? Other way around. So goblets 41 plus 115, especially on the left side, reducing method. Because this way you open the diamide. Meanwhile, you use some points to regulate the discharge of the water. Triple bladder 39, do my 5, bladder 23, spleen 6, spleen 9, etc. Simple points to regulate the diamide, to promote urination. After 20 minutes, go to bed, go to toilet. It's easy. It's easy. No complaint at all. Why? Because it's the blockage of this the stones is gone. Is gone. Without differentiation, without meridian differentiation, you will say, oh, spleen 6, spleen 9, sectors will not be helpful, not helpful. Because this is not burning sensation, so there's no damp heat. It's only blockage of the corridor of the urine. This is a triple burner. But sometimes people don't have tennis elbow, but they have complaint of elbow pain. Tennis elbow is indeed large intestine, but there people have some injury, some pain. So in this case, people could have some small intestine, also possible small intestine involvement. Now, it is again clear. If we only concentrate our attention for large intestine, for triple burner, it is again no effect. It is due to plastination, due to external invasion. No, you have to add some local points. For example, spleen, small intestine 3, 6, 8, 10, for example. What? Local points. Local points. Some people who have the tense elbow due to wrong movement or just the elbow muscle pain along the lung meridians, here, lung meridian. And then, of course, we have to work on the lung meridian. We have used some local points, 5, lung 5 and 6. So here is not because it is C point we use, it's local points. Meanwhile, we use the Shikhai point, lung 6, low point, and the stream point, Yuan point, right? So this is a way, very simple but effective. Meanwhile, we can see if it's people really complaining of the lung disorders, phlegm, insufficiency, some external pathogenic factors in the lung of this and that. We have to treat the lung. We use lung 1, blood 13, etc., etc., etc. So as long as the lung organ itself is not involved, we don't need to touch the lung organ. But if lung organ is involved, indeed, we have to regulate the lungs. For example, people who have COPD, who have asthma, who have troubles with difficult breathing. Meanwhile, elbow has troubles. We have to treat the organ of the lung and also meridian of the lung at the same moment. Next is about talking about the golf elbow. Golf elbow. Somebody who often play golf or playing golf without training guidance. So people can have some acute golf elbow, which is that interior median epicondylitis. So the inside the elbow is painful instead of a tennis elbow with involvement of the large intestine. And in TCM, it is not caused by the other factors. It is caused by hard meridian disturbance. It seems golf elbow is very annoying, acute, painful. However, if you follow in the same way to see if it is external invasion or blood stagnation, mostly is blood stagnation, seldom external invasion. Why? External invasion mostly could attack the young meridians because the young meridians are exposed to the nature, situated, distributed on the exterior aspect of the arm. But our yin meridians, hard meridian, is situated, distributed at the interior aspect of the elbow. But in any case, blood stagnation is a major cause. Wrong movement, overworking, forced sport movement, etc. So we use different meridians, different points from hard meridians. For example, we use hard 3 for what? As local points. We also use 5, hard 6, etc. is to regulate the low yuan point, etc. We use hard 7 is the yuan point to calm the heart. Usually it is enough. It is seldom that the golf elbow is due to disorder of the heart organ. Seldom, because heart is emperor. It should not be involved. If it's involved, it's serious. Usually it's not involved because they have palace, they have a good protection. Don't worry. So this is enough. This is enough. Until now, 1 point is still missing. 1 point is still missing. When tennis elbow, golf elbow happens, 1 point is there, should be included, which is gallbladder 34. Why? Because gallbladder 34 is responsible, is the point, what we call the, for tendons. For tendons. Without these points, you are not able to bring the effect to the tendons. Of course, if it's a muscle, say, oh, it's muscle. It's not a tennis elbow. It's not a golf elbow. Okay, this point can be left out. But if it is tennis elbow, tendons, swollen, hotness, weakness, then this point is surely suggested to be taken. How do you know it is tendon? How do we know it is muscle? One test is easy. That when people have a lack of a force, weakness, unable to grasp something, it's tendon. If it's only local tenderness, muscle soreness, no loss of power, it is a muscle. As muscle. We don't have the point for the muscle. However, we only have the confluence point for tendons. So gallbladder 34 should be suggested to be applied when people have of the tendons. In severe cases, when people have insomnia, wake up during the night, and restlessness and fed up emotion, say, I have so long time, I cannot use my elbow. I have been to the doctor injection. I've been taking painkillers. It is so annoying. Pay attention. Her mind or his mind is disturbed. because of the pain, then certain calming points should be added automatically. Certain calming point is usually not necessary in case the pain is not so severe. But if it is too severe, too heavy, making troubles for sleeping, mind, palpitations, angry, stressful, then the points should be added. 2 points should be added. In severe cases, it can be a little bit more, But don't use these points as a symptomatic treatment, but only using these points for the pain. That's not enough. And also, don't forget, our elbow is corresponding to what? To our knee, and then the knee is situated at the lower limbs, and then we have to select the corresponding points from our knee. For example, if our tennis elbow is at our large intestine, beside the points we have used, suggested here, right here, we also can use the corresponding points on our knee, which is around stomach 35, stomach 34, stomach 36. So around these areas, mostly you can find some places which is quite obvious sensitive with the pain. Puncture on that Moxa reducing method first, for example, you will see that the pain could be improved already. Could it be improved? All those points under the knee can be added during the treatment. It's the same. It's the same. But
Professor,
yes.
I have a question. Do you use the knee on the same side or on the opposite side?
Same side.
Same side.
Usually we suggest to use same side. Yesterday I told you, except this side is paralyzed, or has been punctured for 10 times. And this side is tired, is exhausted. Then we move to the opposite side. For example, we treat the tennis elbow on the right side. He has or she has tennis elbow at the right side. But after a few times treatment, you can move to the knee on the opposite side. You can also move to the treatment complete to the left side. It's possible. But then also try to find a shift point, positive point along the meridians. Yeah, along the meridian. We have a different technique. There is a saying in expression saying, every road lead to Rome. In Chinese, it also says, every road lead to Beijing. It means we have different possibilities, but direction must be correct. We should not make any mistakes. Good. Any question about the elbow?
If you decide to do the horary point selection with the knee, do you need to do the action? Do you need to do the other points as well, or is that just an additional treatment?
Usually this is involvement with the organ involvement. Then we do horary points. If it's locally, not necessary. Not necessary. For example, if the lung is COPD, phlegm, right? Okay, so it's excess. Lung is metal, okay? And which is the sign of the metal? Do you remember?
Yes, it's water.
Water, okay. Lung water, okay. Water, what is the water points of the lung channel?
It's the G point.
It's lung 5.
It's Chiza, yeah.
Okay. And what is the lung points from the lung organ? I mean, what's the sun organ from the lung?
What's the sun organ? So the the water point gives rise to the wood. Is that what you're asking?
Water organ, which is a water organ? Kidney,
Oh, okay, yeah.
right?
Mhm.
What is the water point from what kidney channel?
Water point from kidney channel would be it would be the Ge point. It would be Yingu,
Yingu, very good. What's the number?
kidney 8.
Kidney 8?
Yingu, is it not
No,
kidney
no,
8?
no, 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 no. The number is wrong.
Kidney 10?
Yes, good. Okay, clever. But this is the case when only the organ is involved. If the channel problem is, don't use the horizontal points.
Okay, thank you.
Okay, very good. So the chat I have showed you, please remember and please use it in practice, right? Of course, usually I must tell you, we don't need to use so many kinds of technique. Local treatment, meridian differentiation, Yuan law technique are more than enough to help patients. More than. If, for example, they are so restless, you use some calming points. And if you use, if it's so difficult, you use the organ points, large intestine, the lung, etc. But I have introduced you the different possibility, but usually not so simple. Not so.
Do you use electro acupuncture as well?
Yes, of course. It's again like moxa. Blood stagnation also can we also can use moxa, because moxa is not only for cold but also for blood circulation. So electrical needle we can use. For example, for acute pain we can use continuous waves. Yeah, continuous wave. And also for chronic case we can also use tense dispersed. Yeah. Tense dispersed waves, and this is a good one. You can use one connection, or you can use two connections, of course. Good. And also, you can use massage, you can use herbs, etc.
Professor?
Yes.
I have one more question. The rest of the class probably remembers. Last week I had a patient with me. She's my pedicure. So her work is pedicure. She uses her elbow a lot. And she has epicondylitis. And
Tennis elbow, yeah, tennis elbow, okay.
Sorry?
Tennis elbow, yeah, epicondylitis, yeah.
Yes. She was treated in class and the pain was gone. But when she started working next week, it came back.
Good.
And she also had a recurring bladder infection, which we didn't really treat in class. But would there be also a connection with that bladder infection?
Good question. Of course, her profession is a pedicure, and she used her elbow for months, years with the same position. It is not due to external invasion. If she said, I practiced for pedicure for 2 months, now I got it, so it's external invasion. But usually, this case is already practicing pedicure for many, many years. Now she has it, blood stagnation. So for sure, blood stagnation. Secondly, that her main involvement of the meridian is large intestine, for sure, large intestine. But also you have to check, because she complains of a painful urination, blood infection, to see if a small intestine is also involved or not. But if it's involved, you have to treat the small intestine as well. Yeah. And then you have now two possibilities. One is large intestine involvement, another is small intestine involvement. But then you have to see why she has this kind of a damp heat in the lower jaw, in the bladder. Does this damp heat also exist in large intestine? How is about the stools? Is there any phlegm, diarrhea, burning sensation in the anus? So
Yeah.
if yes, then it's a damp heat in the lower jaw, including the bladder, small intestine, bladder, and large intestine. You have to clean the large intestine. So you use point, you add the large intestine 2. You have to add the large intestine stomach 25. Do my 5 sections. So, for example, to clean the triple burner, clean the lower jaw. And meanwhile, also you use extra point to not for elbow, but for her bladder. For example, you can use like 40, bladder 63, 64. Oh, marvelous! A spring 6. So this way treatment, you combine you put your chief attention for the large intestine, but meanwhile you give supplementary treatment for bladder, clean up the damp heat. Marvelous. This is the way of TCM differentiation. Good. We take another break for 10 minutes. We come back at 12:30. Is okay?
Sorry, I have one question. About
we can ask question after the break. Is okay?
Yeah, it's just to repeat something you said because I didn't understand.
Okay.
One word. When you were talking about the electroacupuncture, you said that for acute conditions you use the continuous mode.
Yes.
And then you said the other mode for the chronic, but I didn't hear.
Tense, disperse.
Tense, disperse.
Not
Okay.
intermittent. We have 3 waves.
Yeah, I know.
Continuous, intermittent, and tense, dispersed.
Yeah. Okay.
Okay. Good.
Thank you.
We take a break for 10 minutes. Okay.
Yeah.
See you later.
Right. I'm pausing, guys. Remind me to start the recording.
Yes. Yeah.
The human body. It really resonated with me. And I was wondering, is this like, has the Academy of Chinese Sciences, have they done experiments on it? Or is this like a folklore wisdom about Moxa?
I don't think so. I don't think so. I tell you, in the last 40 years, 60 years, a lot of scientific research have been done at home and abroad. But pity enough, unfortunately enough, most scientific research are done on individual points. It means stomach 36, what effect, how it works for heart, for this, pericarditis, for this, for that. But this way of scientific research has isolated TCM. It means that it is not TCM, it's not scientific. It gives some evidence saying pericarditis is good for that, stomach 36 for that, spleen 6 is good for that. But there's no sense at all. TCM never asks you, say, please use this pericarditis to treat heart pain, never. But if they carry out research on group of points, for example, for heart, for example, if people say, for heart plastination, different kind of a complaint, we use a group of points to regulate the heart blood circulation. Never. No one scientific paper is done like that. We consume huge money for scientific research. But until now, who is using that scientific research result as evidence? Nothing at all. So the money is wasted. No sense. I don't agree with this kind of scientific research. They put the title of scientific research. It's nonsense. It's nonsense. It is acupuncture is far more complicated than any medicines. Because medicine, you can research their molecules, their structures, but acupuncture is different. They're a completely different system. One is based on mathematics, chemistry, biology. Another is based on energetically. But until now, the machine is not strong enough, equipped enough, developed enough to show evidence how this energetically working. Okay, it's not. So it takes another few hundred years before they can verify how TCM could work. It takes a few hundred years more. But don't believe what the so-called scientific research. They cannot prove TCM. Then it's not scientific. No, TCM is far more than scientific. The science is at the moment is a tiny baby. It's for, let's say, 100 years old. How can you use 100 years old wisdom to verify the wisdom of a few thousand years? It's not possible. Your child is 1 month old. You cannot ask your son to educate your grandmother. You cannot. It's different level. It's not the same. Okay.
Professor?
Yes.
I had another important question about medication, pain medication, the heavy one like tramadol. How does that? How do you interrelate that with the treatment? Because there's certain medications are, for example, very cold or very. I mean, how do you? Interrelate that within your treatment. How do you see that?
It means medication, of course. Medication has a lot of positive points. But don't forget, if you open a list of side effects of each medication, they have more than 20 lines or 30 lines of side effects. So the indication is quite limited, only 2 lines. But the side effect is much longer, right? For example, we take anti-diabetes drugs, right? This is very popular. People take lifelong for treatment of diabetes 2. However, one of the diabetes, right, patient, okay, and by taking medications, they can develop a lot of other complaints, due to the medications. It's the same for the medication to lower down blood pressure, for heart disease, etc., etc. And then they can cause, for example, diabetes. For example, cholesterol lowering tablet, right? It's very classical. Simvastatin, all kinds of vastatin. And one of the 10 patients, after taking the vastatin, they can develop diabetes. 1 of the 10. It's quite a lot. So it means they are going to disturb the pancreas. The side effect is quite a lot. 10%. However, compared to the life they saved, they still accept this side effect. Our society is full of medications, and I believe so many chemical drugs have influenced each other, and it is a disaster. We do need classical medicine, but until this moment, scientific research are still quite young to verify what is interaction. But we believe so.
May I ask another question since we are on this subject?
Yes.
Recently, I came upon the idea that some medication can actually block the effects of acupuncture. Is that true?
Oh, so true. For example, beta block. Corticosteroids. Yeah. And of course, those medicines, don't forget, acupuncture is a kind of energy movement, qi circulation is based on this. Because qi movement, it clean up the damp, clean up the blood circulation. But this qi movement need help of one organ, which is the liver. Liver is making smooth qi circulation. Majority of the pills, chemical drugs, medications are mainly working. It's of course it's in the chemical factory in the liver. It disturbs the liver. It influences the liver. Finally, the qi circulation, the movement, energetic movement will be influenced for sure. Antidepressant pills. If people are taking antidepressant pills, the beta blocker, so the acupuncture working is limited. You have to do big efforts to make them improve. You see, and then we have to say, when the symptoms better, we immediately ask permission, talk to the house doctor or to the psychiatrist that diminish the dosage of the antidepressant pills. And usually, patients are advised to take the antidepressant pills at least for 6 months, at least. But for a lot of neuro complaints, we don't ask to take so long time. After 2 or 3 months, take it. So you tell the psychiatrist, I said, that you are now helped by the doctor who practices acupuncture. Most of them accept it. So as long as you don't have complaint, so diminish it. Of course, this is with permission, with agreement of a psychiatrist, with house doctor.
Professor San, may
Yeah.
I ask you something? And how is about acupuncture and local anesthesia? I mean, epidural of subcontinental anesthesia. What is the working on?
Of course, it is scientifically proved that acupuncture can improve the anesthesia effect. Why? Increase the pain tolerance, and also improve the reaction for the pain, and also recovery of the after operation, etc. It is for sure. It is for sure. Because anesthesia is also working on the energy, on the nerve system, and TCM working with the meridian. Meridian included nerve system, neuron transmission, the spinal conduct transmission, etc. Brain interpretation, etc. It is for sure. But I believe one sentence that is true, that in future it will be proven acupuncture and herbs are one of the best system for medicine. Maybe in my life I can see, but in future they will be proven acupuncture and herb medicine are the best of the medicine. So we can combine with TCM and the classical medicine. We combine. We take the advantage for patients, for people, to make to promote the health of mankind.
Dr. Sun, since we're on the subject of anesthesia, you mentioned yesterday that there are still places in China and hospitals that practice acupuncture for anesthesia. What about for labor? Is that something that's very popular, or?
That's what Beata
Oh
just
yes, this is true. It was filmed by Italian's famous registry conductor in early 1970. A film. What's his name? And you can search acupuncture. This film is, you can search from the YouTube. And one of the topic is that people was operation room conducted the acupuncture anesthesia for a labor, child delivery. It was so much pain. They used acupuncture, and the video showed, and they used acupuncture for anesthesia. They have cesareans, and they had the childbirth doing the whole procedures. It is fantastic to see. Fantastic to see. You can search on.
I'll take a look. Is it still practiced though? Is it like it's not a very common thing? I take it then.
Not common. Why? Why? Do you know why? Because people want to take the advantage of a classical medicine. They want to take it. It's convenient. It's less scare, less pain, etc., etc. So like that. And it's also not a popular, widely practiced. Only during Cultural Revolution, it was widely practiced because at that moment the medical system was still backward, and Western medicine was not popular. People living far from city, so they accepted anesthesia. But now they actually reject the anesthesia by acupuncture.
And what about in Belgium? Would you be allowed to attend a woman in labor and give her needles, or would that?
I would like to. Until now, I haven't done it, but I would like to. I think I will accept it. And also people, when they see my CV, they could accept it. But it's, of course, you need cooperation from the hospital, not in the practical, in the private practice during the labor.
It's a problem because where I live in France, and it's basically you have to be a doctor. So
what did you say? You are living in France, and
I live in France, and acupuncture is very complicated, and in many sections of society, you have to be a doctor for it to be recognized.
Okay. I see. You're not from Holland. You're not from Holland. I see. Okay. Okay. Interesting. Okay. But I believe when they will come investors, yeah, they can choose nature labor with acupuncture or labor with medication. In that case,
I gave birth with acupuncture.
what did you say?
Wow.
I gave birth with needles.
Yes. I remember
the same child whose placenta I have.
I have my oldest daughter. She's 28. 28 years ago, I had a patient. She was pregnant, and she had at the same moment delivery. She was afraid of the pain of delivery, so I suggested I put some points in bed needles, and then her doctor knows me, her gynecologist knows me, Dr. Sun. So then it was so easy that I put like 4 split 6 in bed needle, only these 4 points, and asked the husband to puncture, massage on this embedded needle, and the delivery went so smoothly. I remember very well. So the gynecologist said, "Oh, Dr. Sun is doing good job." So they accept it. Okay, let's move to the next topic. It's about low back pain. Low back pain. We have different cases. It's more complicated for low back pain. As a moment ago, I talked about an older man came in with the difficult urination, also low back pain. Yeah, her main complaints were 2: low back pain at the left side, and also difficult painful urination. 2. So these also kind of a pain syndromes. So low back pain is more complicated than shoulder pain, elbow pain. Now, if it is acute, a running nose, catch cold, standing outside during the rain, etc., it's due to wind cold damp. really cold due to external invasion. So the treatment is same like what we have discussed, like now, we exactly same. Okay. To eliminate wind cold damp with attention to different pathogenic factors, for example, wind cold damp. This basically. But secondly, is that we have to also working for different causative factors. The causative factors means that if this is due to blood stagnation, we can still give some same point treatment like we discussed already for blood stagnation. Blood stagnation. How about the chi stagnation? We did not discuss. Okay, because sometimes people have low back pain related with emotions, with stress, right? Because our diamond, our gallbladder meridians, our liver meridians are related with our low back. And also our liver chi stagnation due to stress could influence the chi circulation in the bladder, in the duma, in the kidney channels structures. So stress chi stagnation is indeed also one of the common cause in Westers. The difference between chi stagnation and the blood stagnation is chi stagnation has an obvious relation with emotions. Worse by emotion, improved by relaxation. But blood stagnation is a situation that is fixed location, long history, stabbing pain, right? And chi stagnation is not stabbing pain, it's the standing pain. If we use the same system to treat the chi stagnation, it will not be working. We have to relax the chi, promote the chi circulation in the liver, in the gallbladder. For example, liver 3, liver 5, liver 12, liver 14, pericardic 6, pericardic 6, gallbladder 34, gallbladder 20, reducing. Very clear. But you are clever now. If we stop here, we'll bring 20%, 30% the effect. Will be better for emotions, will be better for stress, but for pain will not be helpful. Why? Because this is the patient who did not complain of overall body pain, only complains of low back pain. So the area at the low back region is blocked. So we have going to combine our next step here, points from affected channels. We will discuss later. First, we talk about how to resolve the chi stagnation. Okay, this is chi stagnation, but sometimes it's due to damp heat, downward flowing, damp heat in the large intestine, damp heat in the kidney channels, damp heat in the bladder, damp heat in the lower jaw. How do you know? Burning sensation in the urination, burning sensation in the genital regions, itching, swelling, redness, fever, urgent defecation, loose stools, they all damp heat. We have to see which organ, which tissue is mainly involved. Damp heat. damp heat. So in this case, we have to show that people have lower back pain with heaviness, burning sensation. Besides there's painful urination, besides there's urgent urination, besides there's the genital itching, pain, etc. But anyway, at this moment, it's damp heat. We have to clean damp heat. And meanwhile, we have to clean the meridian disturbance. Damp heat, we use different points. Spleen 2, spleen 6, spleen 9, stomach 40, kidney 2, okay, bladder 32, okay, GV 5, bladder 22, reducing.
What about kidney 7?
Kidney 7 not necessary. It is mostly nourishing, heat tonifying. Heat not. If it's a painful urination with slight painful urination, low back pain due to the damp heat in the kidney, then we can use kidney 4, 5, for example. But kidney 7 not. This damp heat. Other way that some people have a kidney deficiency of kidney gene. That's low back pain when people are tired. When they're overworking, people have low back pain. Low back weakness, knee weakness, etc. Old, and also hair loss, memory loss. But then we include kidney yin and kidney yang deficiency to see. Anyway, kidney tonification is for people who have arthrosis, degeneration, age, etc. Deformity. We use here now kidney 3, kidney 4, kidney 5, bladder 23, GB 4, okay, kidney 10, okay, spleen 6, stomach 36, 25. Until now, is that enough to solve the pain of the kidney, low back pain? No. This is all causative treatment. Until now, it's causative treatment. We have to move to the treatment according to different meridians, pain relieving. Second step. Usually, following meridians are involved. First is bladder meridian. The second is gallbladder meridian. These are two channels are mainly involved. Sometimes both of these two meridians are involved. Sometimes only one of them involved. If it is both involved, we can take these two groups point and take the main point from these two groups and treat the patient. So suppose if the bladder meridian is involved, right? So you can see radiation pain or painful along the bladder meridians. We use, this is the local points. And then this is the low C points of bladder, low points, Shiklet points, Yuan points. Wonderful. Local points plus the points going to Xi point, low point, Yuan point, etc. to harmonize the bladder. If it's a gallbladder, also the local points plus the Shiklet point, low point, Yuan point, and also point to regulate the diamine. So normally, if this point are often used for treatment of hernia. The severe case is hernia, or people have operation still painful. They say, hey, according to the MR, everything is perfectly done. You still have pain, you have to live with it. It takes time, but we give acupuncture treatment. They are quickly improved. And then we have to make differentiation according to the blood meridian of gallbladder meridian. So this is a very correct way, local treatment, yuan point, low point sectors, Shikla point sectors. Sometimes there's, from time to time, there's stomach meridian blockage. Of course, this is also local, for example, local treatment, but not often, seldom, stomach there. That is Shikla point, low point, yuan point. If it's a liver meridian, is more often seen than the stomach meridian. We have this is you see the local points together with the yuan points, low points, such as to relieve the pain, ashi points. So looks very complicated, but if you follow my suggestion, cosmetic treatment, meridian treatment, together with necessarily ashi point, the certain common points of horary points, if necessary. And when you are able to manage this shortcut illustration, you will be happy to solve most cases with the low back pain, most cases. But don't forget, you have to do two most important steps. One is cosmetic treatment, another is channel treatment. Without these two treatments, if you only come to local ashi point from there and from here, there you use a point, it's not enough. It's not enough. Any questions about low back pain? Probably you have a lot of patients, more patients with low back pain than patients with neck pain, elbow pain, right?
I didn't quite understand the difference between a bladder and gallbladder low back pain.
Have you seen patients with gallbladder? Because hernia, for example, hernia with, for example, at the L4-5, mostly is gallbladder channel. The hernia at the L5 S1, majority you can see is a bladder meridian. So you, without identification of the troubles, and then you are not able to help patient. And then one more, small intestine 3. That is very important. This is the way to open the domai. So if people have a hernia, low back pain, degeneration, operation, and these points should be firstly opened. Because they have a hernia, because they have low back pain, gallbladder, bladder channels, but this point channel should be firstly punctured. Without puncture of this, and you are not going to open the rest point because stoma is blocked. So this is symptomatic treatment. And also one point is true, bladder 11. Bladder 11 is a guide point to lead the treatment into the bladder, into the bones, because it's the hui point, the gathering point for the bones. Good? Okay. So this is actual information you have to understand. It is extremely important to relieve the pain and also go into the certain areas. Any other questions, please? Okay.
Yes, Professor, one question.
Yes.
Would you use the points small intestine 3 and the 62? Do you use them bilaterally or does it depend?
Across, right?
Huh? Yeah.
Across, for example, cross. Good, across.
The woman begin with the right, the man.
Yes. Okay.
Like you said, yes.
This way of crossing application is Western styles. But TCM have never used that system. If, for example, people have a herniation with radiation on the right side, for example, between 4 and 5, then you use only on the small intestine 3 on the right side and bladder 62 on the right side, right? But if people have both sides, we suggest that both sides you use the points at both sides. Possibly, sometimes patients are afraid of needles. We have to try to use as less as possible. And then we use cross point. Lady from the left side, from the small intestine, and with the left bladder 62, as less as possible. But mostly, we suggest both sides. If the complaint is at the one side, we suggest one side.
Professor San, and do you open the Dumai meridian first and then put you the other parts?
Yes.
Okay.
You are right. Okay, you are right. You are right. Ladies at the right, men at the left start puncture. Good. We are going to take a break and we'll come back around 2 o'clock. Is that okay?
Yeah.
Okay, see you then.
Bye.
Yeah, bye-bye. Thank you. Okay. So after break, we are going to continue the rest of the topics. And now it goes much easier. Why? Because no matter it's a lower back pain, hip pain, for example, Achilles pain or knee pain, etc. The only difference actually is at the meridian differentiation. Exactly speaking, is at the local points, because the point to guide for wind cold invasion or for chi blastination, etc., are the same. The yuan point, the lower point, shikai point are the same. But the difference now is how can you induce the effect to certain complaint area. Now we take the example hip pain. Hip joint is that is mostly that people complain. People only have hip pain or have a low back pain radiating to the hip. Doesn't matter. Usually, hip pain, especially hip joint pain, is the local area of it's connected to the low back pain. Therefore, we have to treat the low back pain and the hip pain at the same moment. The treatment is exactly the same. And also we have to make some differentiation, and especially make differentiation to see what is the cause factor. Is it external invasion, or it is blood stagnation or chi stagnation? And then we have to also make differentiation to find out which meridian is involved. And then we use some local points. For example, if people come for low back pain, then you should concentrate your attention for local low back pain. For example, you use a low point, Shikle point, yuan point, together with some local Ashi point. Some points at the local area of the low back pain. Now it's same for hip pain. So it is the same procedures to treat its causative factors. However, the treatment with the meridian differentiation is also same. But the only difference is that we have focused our attention to the place around the hip joint. Hip joint has a much more easy etiology, pathology. Mostly it's these two meridians, especially the gallbladder meridian or the bladder meridians. It is not easy, not difficult to understand to choose the points. Goblet 29, 30, 31. But that's all the local points. That are the local points for the treatment of the hip pain. You still can add some local ashi points, 2 or 3 points, even necessary, or one of them, one local ashi point. So then this effect is going to, you can also 30, Goblet 37, for example. For example, is to reduce the pain, reduce the pain. This is the yuan source pain. You can also use, for example, triple 5 in combination with Goblet 41. We can put the triple 5, Goblet 41 as a first. Understand? And first. So we can use to open the actual meridians in this way. We put it first. And then afterwards, we can add Goblet 29, 30, 31, the local points, or 1 or 2 local ashi points, then other points. Other points, even for example, Goblet 40, reducing method. Don't forget the causative treatment. In this way, you will see that your treatment will bring immediate result. You can add cupping, you can add electrical stimulation, you can give some lamp warming, etc., etc. But that all are the supplementary support help. This is the way to deal with the pain during for the hip pain caused by disorder of the gallbladder channel. If it's the same, if it's a blood meridian, it is mostly at the sacroiliac joint. So local places, for example, bladder 32, bladder 4 are, for example, to my 2, bladder 34, etc. They're all considered as the local points. Local points. And then we have used 58 low point bladder, 63 Shikler point, bladder 64, a yuan point, bladder, okay, sectors reducing 65. It's the stream point going to the joint, etc. Without the local points at these places, you will fail the result because you only harmonize the blood meridians, relieve the blockage of blood meridian. But local pain is the indication, means that there is a heavy chi blood stagnation at that area. Okay. This is the normal way to deal with the hip pain. But of course, you can add some Shen calming points. You can use some points related with the shoulder. Because shoulder is considered as the hip, corresponding to the hip. Also, blood meridian is the Taiyang meridian. Taiyang means small intestine. You can try to find on the the shoulder joint to see where is the tiny bit acupoint at around the shoulder scapular region. Gallbladder is a sanjiao on shoulder. Good. And also stomach meridian. Sometimes there's pain, but it's the same local area, local places, plus the secret point, low point, yuan point, to regulate, to support the stomach meridian. But local points should not be missing. You will be clever enough. If we are going to treat the knee pain, knee, there's cross tendons rupture, there's meniscus rupture, and there's prothesis, there's degeneration, there's joint complaint, there's a rheumatic complaint. Not at all, no worry. Do the same way as now. But the only changes is that the local points is changed. Rest is all the same. Causative treatment and she collects lower point from different meridians, but you should never treat the stomach meridian and expect that the result will improve, that people have a pain at the hip due to the spleen meridian or kidney meridian or liver meridian. It's not possible. Yeah.
Professor Sun?
Yes.
How does TCM actually view hip and knee replacements actually?
Good, fine. In TCM, we don't against this. During the prothesis, some ligaments are changed, of course, or disturbed. It is possible that after the prothesis, certain places remain pain, especially in the first 3 months. It would be not possible that all the meridians are involved. Otherwise, people are dying. Impossible. Must be 1 or 2 meridians are involved. Mechanically, due to operation, due to wrong movement, etc. And then TCM have to make sure that there is mechanically nothing wrong. So if the surgeon says that mechanically everything is okay, somebody ask question, okay. And then if mechanically speaking everything is okay, then you only look at which meridian is involved. Mostly the blood stagnation, because operation, because prothesis. Blood stagnation before the operation and blood stagnation after operation. And also due to the emplacement of the artificial joints. So blood stagnation is the main point. So you circulate blood stagnation, is not external invasion, but and also differentiation is made according to to find out which meridian is involved. You use low point, yuan point, secret point, and then you use some local points to induce the treatment to go to that area. And finally, if it's still pain, you use the same coming points, you use corresponding points on the shoulder. Somebody asked, is missing for the wind cold damp? Indeed, I'm talking that is the same treatment for causative treatment. The only difference is that the meridian, the second step is changed. The rest is always everything same. External wind cold damp invasion, you have to eliminate wind cold damp, for example. And I will explain why we often talk about wind cold damp instead of talking wind damp, wind cold, or wind heat, or wind damp. I will talk about this immediately to let you know what's the difference of these expressions. This is the hip joint. Now, if I let you decide how can we manage the hip pain, you have never listen to my topic. But now, according to the same history, okay, if somebody come to you with a knee pain, with a prosthesis, with falling down, with falling down from the football, basketball, with meniscus, with injury, this, that. I believe now you are already clever enough to manage the knee pain without looking at my next page. Okay, without looking at the next page. We don't lead us to the next page. I will ask you, what do you think about the knee pain? First of all, you should think about the same causative factors. Is it acute or chronic? It's because that you went out riding bicycle, you're riding motorcycle, you swim, you put your leg outside of the blanket, you stand outside with the knee towards to the wind. So it's external wind called damp. Sometimes it can be wind damp heat, but anyway, it is external invasion. Acute with external symptoms, and also there is some external symptoms showing runny nose, shivering, sensitive to wind, etc. So what I'm going to do for the causative treatment? Eliminating, dispersing, Latin 4, triple 5, Mark 7, Goblet 20, etc. Right? Nothing else. If it's cold, you use some moxa. If it's heat, you use some heat cleaning herbs, heat cleaning points. Secondly, now the most important is meridian differentiation. The knee is a completely places with involvement of 6 channels, 3 yang channels, 3 yin channels, right? Okay. 3 yin channel including liver channel, spleen channel, and kidney channel. 3 yang channels including the bladder, gallbladder, and the stomach. Mostly is 1 channel is involved. In some cases, not so much, so not so many. There are 2 channels. There are 2 channels. But if I say, yes, Dr. Sun, I have a knee pain at the right side behind my knee, for example, back kyst. Back kyst means that there is a cyst at the back side of the knee. We call it back kyst. So it means that blood meridian is involved. You don't care, you start to treat the stomach meridian, you treat the liver, you treat the spleen, no sense. You have done your job, you just waste of your time, waste of your energy, waste of money. You have to go to the blood meridian. If you say, yes, but I have played football, I have meniscus. I say, oh, which side one? Median side, one side. Oh, it's spleen meridians. Spleen meridian. Oh, yes, because it's my meniscus was a little bit ruptured at the outside the lateral aspect outside. Oh, it's the stomach meridian. Yeah. Oh, no meniscus problem. I have checked everything. No inflammation, but I have a tendinitis at the lateral aspect of the knee. Oh, yeah, it's the gallbladder meridian. So blood meridian, gallbladder meridian, whatever, differentiation. So you use same system to eliminate the pathogenic factors as first step. Second step is that you use yuan point, lower point, Shikle point. Continue with local points, right? Now we move to the knee pain. Okay, so here is which meridians? 6 meridians, all meridian possible. We take, for example, bladder backside, a kyst, back kyst. So bladder 63, especially for example, bladder 29, 40. They are the key points, for example, key local points to lead the treatment to the knee. Should these 2 points punctured first or second later? Doesn't matter. Doesn't matter. Anyway, you cannot miss these 2 points. You can add 1 or 2 local points. Normally 1 point is sufficient. We use 58, 63, 64, 65, etc. Doesn't matter. You have to. You have to. But don't forget, if the injury is mostly cheap lastimation, you use Latin 4, you use the spring 6, bladder 17, hard 3, lung 9, etc. Right? And then you have to follow. The treatment should be followed by using the points like this. Okay, very clear, right? Etc. Suppose somebody who has the pain at the meniscus, lateral aspect of the meniscus, or suppose they have both meniscus, lateral and median. So then you take 2 yellows, spleen and stomach meridians. Spleen, stomach. Spleen is responsible for median aspect of meniscus. Why? How do we know? Because people have pain, swollen. People have normally the CT scanner showing that a median aspect of the meniscus. But that is number 1. But number 2 is that they have a complaint along the spleen meridians. Spleen meridian. So here is, for example, spleen 9. Spleen 9. Spleen 10. They are the local points. They are the local important points. Meanwhile, you use the low point, Yuan point, secret point. You see? And then the pain must be improved. So because of your treatment, you could improve the pain, but also improve the meniscus. Yeah. Usually, the chance is big that if there's a mini tear, the chance is big that you can avoid operation. But if they say, yes, I have also outside the not median, but the exterior meniscus of crossbound, cross tendons have troubles, then you use those points, 35, 36, 34, that are all the local points, together with the low points, yuan points, etc., to relieve the pain. To relieve the pain. After all, you understood the knee is related with our elbow. Our elbow is corresponding to our knee. So try to find a corresponding channel involvement per patient, same side, not the opposite side, right? Acupuncture can greatly help patients with a different situation. Somebody who has said, I have no more problem with the knee, but the meniscus, but I have knee pain due to degeneration, right? Arthrosis, again, depending on which channel. Kidney channel, liver channel, gallbladder channel, stomach channel. Find the local points, Ashi point, Yuan law technique, Shiklet point technique, shoestring point technique, Ashi technique, Sen technique. Now we talk about the ankle, Achilles space. Achilles space. So here you don't have the text for Achilles space, right? No. So if people say, oh, I have, oh, for a long time I have a Achilles space tendinitis. Achilles tendinitis. Pain already 4 months, right? They have changed to change. They have stones or shoe support, change of the shoes. Don't worry. Tendinitis is much more simple. Only 2 meridians are involved. One is a blood meridian, another is a kidney meridian. Another is a kidney meridian. So you have to ask a patient, show me where is the pain. If it's in the middle, I try to find out is more tenderness at the blood meridian or kidney meridians. Then you can find out which meridian is involved. Mostly, it's only one of them has troubles, bladder or kidney. Suppose people who have the Achilles space, mainly at the interior aspect, at the kidney 3, kidney 4, kidney 5, or even up to kidney 2. Then you treated this blood meridian, you treat the gallbladder, will not work. Will not work. And you have to treat costly factors, yeah, and or blood stagnation, or damp heat. Sometimes it can be damp heat because due to local infection, swollen, hot, redness, etc. So causative treatment is step 1, and then second step is to regulate the meridian, or bladder, or the kidney. In this case, then you use the yuan point, low point, Shikra point, plus the local points, plus the Ashi point. This seems very complicated, but now you know the way. Western medicine often talks about the evidence-based medicine, but this is evidence-based medicine because you have regulated the meridian, you have found the cause. If it's a spleen, if it is a blood meridian which has troubles, and you start to regulate the kidney, no, doesn't work. If it's a kidney, you start to regulate the blood, also doesn't work. If they have an involvement of both channels, then both channels should be treated. And find out why you have blood meridian troubles. Is because the blood stagnation in the blood meridian, or because there's damp heat in the blood meridian, or because due to your weakness of kidney, kidney Qi, kidney Yin, kidney Yang, and then regulate. So if you don't know anything about the herb medicine, acupuncture can help already. Our ankle is corresponding to our wrist. So you also can find some tendinous place, Ashi point on our wrist, according to the channel differentiation, to see which meridian is mainly involved. It's mainly, then you can use both systems. The funny thing is that when you puncture the needles, according to meridian distribution, yuan point, lower point, Shikra point, so their pain at the Achilles space could be diminishing, but not yet gone. And then you can use the corresponding places on a hand, so pain can be much better. And then finally, you touch the local points, Ashi point. If it's still there, you can use some coming points. So step by step, you have a few steps. How about the finger pain? Finger pain. For example, or toe pain. So, oh, I have a wrong movement. I kicked my toes against something, right? Ah, okay. So it's injury. It's blood stagnation. It's always fixed at certain places, not moving from one place to another. Right? Fine. No worry. To see what is the cause. Oh, because I kicked, I hit by something, by bottle, by a machine, by this. So, or I have operation. Okay. Okay. So, and then first of course, causative treatment. Yes. Okay. Then, as blood stagnation, you do know the way to manage the blood stagnation. Second is meridian differentiation treatment. You see, is index finger large intestine. Is the fourth toe is gallbladder channel. Is the last toe, the fifth toe is bladder meridian. Right? Okay, and then you have to treat this bladder meridian. But because it is far from the heart, far from the meridians, almost the end of the meridian. So the treatment, the yuan point, the lower point, Shikrai point are useful, but not that useful. Why? Because it's only local meridian damage. Local meridian damage, not that complete meridian damage. If you use yuan point, lower point, Shikrai point, it's a plus point. But very simple, in most cases, a local treatment is sufficient. But make sure if there's no broken. If it's broken, doesn't matter. It will take time, take a couple of weeks, a couple of months. But if its photo shows no broken, no problem, should be better. A local treatment, qi blood circulation movement is enough. Corresponding treatment, if the toe, you treat the finger too. If the finger, you treat the toe, but corresponding. People who have carpal tunnel syndrome, do you know carpal tunnel syndromes? Carpal tunnel syndromes. Carpal tunnel syndromes is a situation that it happens on our one side or both sides of the wrist. You can see, okay, I will share. Okay. Look at here, right? Do you see the picture? Right? You see, right? You see. Do you see the picture? Okay. We take these carpal tunnel syndromes. You see. Here is a carpal tunnels, yeah? And this tunnel is due to inflammation, overworking. People start to have pressure on the nerve system. And people are suffering from the tingling, numbness, pain, stabbing pain, especially at night. And then they have to wake up during night with movement of the hand, shaking of the hand. The pain gets better because they promote the blood circulation. So they went to bed again. But after 1 or 2 hours, they wake up again because blood stagnation. Now we diagnose this carpal tunnel syndrome. Mostly, it is due to blood stagnation. Why? Fixed location. Fixed location. Second, stabbing pain, tingling, numbness, etc. Right? And then also the third diagnosis criteria is that they have also history of injury, same position, same way of working for a long time, But if we look at the TCM, which meridian do they have impairment? Pericardium, and the lung meridian, not the large intestine, pericardium, lung. And also it is because it wakes up in the evening. So the severe pain, so it is sun disturbance. No worry. So in classical medicine, they are going to operate it, to cut off, to open this area. So there is penetration, the places to pass through is getting easier, bigger. Of course, the side effect of operation is complication, local infections, and some people they have also the reoccurrence of the pain. TCM, I must say, 90% or even 95% of the carpal tunnel syndrome can be improved. So high, so high. How can we give treatment? Okay, we focus our attention for etiology, pathology, and the local treatment. So there is no external inflammation. The only possibility is blood circulation. So blood circulating, large intestine 4, liver 3, spleen 6, blood 17, for example. But then the general treatment will not bring any local effect for the carpal tunnel syndromes. We have to move to the local channels. For instance, if people have only 1 finger or 2 fingers along the pericardium, then we use pericardium 8, pericardium 6, pericardium 4. Why? To regulate. Pericardium 4 is a Shikai point. Pericardium 6 is the low point. Right? Pericardium 8 is a through point. Going to regulate the meridian of pericardium. We can also add heart 7, heart 5 to regulate the sleeping, improve the pain toleration. If the lung meridian is involved, that people have thinking of the stomach, then we use the exactly same way. We add some points extra. We add, for example, lung 9 is the yuan point, stream point. We give circulation, reducing. We use lung 7, the low point, right? We can use Shikai point, lung 6. So we are making so good job. Actually, we have to tell you, how can we insert needle? Lung 9 can be punctured perpendicularly. But the heart 7 or pericardium 7 can be punctured with a special needle technique. That is, we call the horizontal insertion. The needle is inserted 0.2 ton. So perpendicularly, immediately you form maybe 10-15 degrees horizontally insert needle in this way. The needle is here punctually, vertically, and then you puncture needle and insert needle in this way, following the following the direction of the channels, not perpendicular, because perpendicular you cannot puncture it so deep. Hard 7 is also same, that you puncture needle 0.2 turn, and then immediately put the needle under the channel, that is what we call the horizontal way of puncture. So here is puncture. You put the needle number. So here is the pericardic. Okay, 7, right? 0.2 turn, and then put the needle direction to this direction, to the tunnel, to make this inflammation better. To relieve blood stagnation. 7 also. 7 is here. Put the needle here. Put the needle here. This is a couple of symptoms.
Dr. Sun, when you
Yeah.
say horizontally, you mean distally or proximally?
Say again, I don't hear you.
When you say horizontally, do you mean distally or proximally?
Okay, I see. Distally. Okay.
Distally, so away from the body.
Yes, yeah. Okay. So tip of the needle should be punctured in this way. Forming not 45 degrees, about 15 degrees, 10 degrees is enough. Put needle, it's not painful. You can use 0.22 times 25 Wentworth needle. Put the needle inside. Wentworth needle. So blood circulation, general, and then local point differentiation, and also the yuan point, lower point, Shikran point, and then the needle technique, inserting needle into the tunnel, and then if necessary, we can use some sun regulating points, gallbladder 20, bladder 15, etc. So that is a carpal tunnel symptoms. We talk about okay. Okay. If people who have another complaint, rheumatoid, rheumatoid arthritis. Okay. Rheumatoid arthritis is not similar as rheumatic. Here, rheumatoid is a different disease. It is autoimmune disease. And this disease often affected the small joints, finger, toes, etc. And if we take example, finger pain due to rheumatoid arthritis, so people have very much pain on fingers. They seldom affect the big joints, the knee, the hip, ankle, shoulder, elbow, not so often. But the finger is the most affected. Deformity, they can have, you look at here, I will show you how serious they are. It's terrible to see that have rheumatoid arthritis. Look at here. Can you imagine? Can you imagine? This is a typical complaint of a rheumatoid arthritis. It's not a rheumatic, it's rheumatoid, similar like a rheuma, but it's mostly affected small fingers. Small fingers. What are you going to do? They have pain all the fingers because they're deformity. They're not able to work. Are you going to put every point? It is impossible because they have pain. You put points on the joint because here there are not so many points except the tin point. It's painful. Don't do that. Again, it is blastination because blastination making deformity. What are we going to do? We use some blood circulating points. Largeness 4, limb 3, spring 6, heart 3, plus 17. It's normal. For all the cases, normal. But then we use the 八斜 point. 八斜. I show you. 八斜. If it's on the toes, we use a 八风. So these extra meridians, extra point. Give support for sedated pain, promote circulation, relieve the stagnation. But also, they will not change the whole mechanism. Therefore, we use some blood circulating points in the general body. And because it is so painful, so we use causative treatment. Meridian treatment, but the meridian treatment is the local 八斜 point, 八斜 or 八风. Okay, but then because it is so painful, it's autoimmune disease. What is autoimmune disease? That the cells, the body
attacks the healthy cells.
They fight with their own cells because they're wrong. Okay, so we have to use the sun regulating. Why? To regulate, to smooth, mostly due to stress. To regulate the emotion and also the pain. And regulated. Good. And then we use the corresponding and also if it is on the and if people who have a toes, finger pain, then you can use the toe. Vice versa. If people have the toe complaint, so much pain on the toes, then you can use the finger. You see, our treatment procedures have made your situation much more clear. Much more clear.
Dr. Sun, sorry, I've got one more question.
Yeah.
So when you use these points, the patient, it's not like it's fully treated. They just have more flexibility, mobility, right? Or
I give full treatment because I have given you causative treatment, blastination.
But will they like become like normal fingers again? No, right? So they can
No, that's finished.
more.
Yes.
Yeah,
Or you
okay.
mean this? No, that's finished. They are not able to come back.
Okay.
But they will be much flexible, less pain.
Okay. Yeah,
Because
thank
already
you.
it's damaged.
Yeah.
I was talk about this. What is the reason? Because it's bone B. It's already B is in the second level bone B. Serious, deep. Good. So we encourage people have early treatment as early as possible. In classical medication, they take a cortisone, they take a lot of painkillers because of very much pain, very much pain. Until now, we have finished the pain from our joints, from our body.
Sorry, Dr. Sin. Can I follow from Vivian's question? If we're talking about an autoimmune disease, will we also not treat the whole the immunity and strengthen immunity?
Yes. In this case, if autoimmune disease, so far, it is already too late. The machine is damaged. A machine is damaged. It often happens rheumatoid arthritis, slight pain, getting deformity, but we have to offer our treatment at that moment, not at the last moment. Last moment already too late. What we can do? Just relieve the pain, diminish the pain. Yeah, not to make it still worse and worse. And also don't forget, usually people have, in this case, have been taking the cortisone for lifelong, many years. Their kidney function is damaged. The heart, the liver, the skins are damaged. Because taking cortisone so much, the skin very thin, like a paper, even thinner than paper. Yeah, but we are not going to change the autoimmune situation. Not possible. Not change his deformity. No, just relieve the pain, supporting, tolerate, because they came already too late.
Yeah,
come too late.
And assuming someone like this would come to you in a very early stage, then how would you treat the systematic immunity?
Good.
Let's go 30 years back.
For example, good question. So in this case, we at least can support the general body. Don't let it to grow, develop, aggravate. Secondly, we can diminish the medical drugs, cortisone, because cortisone will not help for the situation. On the contrary, they will die of this. The interior organ will be kind of a soft tissues, like tissue papers, tears is damaged. So cortisone is very good, like a COPD. They're taking cortisone. At the end, machine is gone. Not possible. TCM is true that we only can improve, support, fundamentally change. If they come too late, it is impossible. It is impossible. We have to be honest because it's also medicine. Medicine cannot solve everything. Good.
Sorry.
Yes.
Can I ask a question about the hip pain?
What pain?
Daimai, hip.
Hip pain. Okay.
Yeah. Are there any Daimai symptoms if it's the Daimai?
No, hip not.
Okay.
Daimai not. Daimai is around our wrist, going to the inglodular region, going to the abdominal, mostly related with our gynecological complaints. When Daimai has disease, it shows a special symptoms that heaviness of the back, low back, feeling like that they're sitting in the boat, sitting in the water, cannot float, cannot sinking. Meanwhile, there's heaviness in the lower back, urination difficulties, pain at the lower back radiating to the inguinal region. And for ladies, they have usually leukorrhea. Most happens for lady. So dimer is important for lady disease. Dimer also is important for people who have a miscarriage.
Because hip pain is an affliction of mine. So
Yeah.
I don't have any dimite symptoms, but
No.
yeah, I was wondering if it's a structural thing, as in one leg longer than the other. That
Yes, indeed. If it's due to the difference in the length, we have to correct it. If it's less than 5 millimeter, no need. If it's bigger than 5 millimeter, and then if it's too big, then we have to ask kind of a support, because it can be sclerosis, congenital difference in the length, or they have ever fell down, did not pay attention, so there is deviation of the back. Of course, in that case, if it's too much leg difference, people have the hip pain, we have to mechanical correction first.
so acupuncture can correct mechanical issues?
Yeah, mechanical correction will not mean that they were going to correct it energetically. No, they were not able to. So they have to regulate the emotion by acupuncture as well.
Because it's the emotions that have an effect on the mechanical structure.
Emotion will not change too much. Of course, there is influence. For example, if they influence the liver, gallbladder meridian, they can make a spasm of the meridian muscles, so they can have a deviation of the back. Indeed, if they have bad position of walking, studying, so they can influence it. But anyway, if there's mechanical problems, we have to also correct it. Pay attention. The lens also pay attention.
So I just want to clarify, because this is a new concept for me. And when you refer to mechanical concepts, if there is less than 5 millimeter difference.
No stones or shoe support.
Oh, okay. Okay, that's what I. Yeah.
If it's more than, pay attention, more than 1 centimeter, then it's needed. And also, it is not allowed to give a fully sole support. For example, there is a 2 centimeter difference, right? 20 millimeter. It is maximum to have a half the length supported. It means you are only allowed to have both shoe support, but one side could be 1 centimeter higher than other one, but not 2 centimeters, not allowed. It's maximum half is allowed to support. If it's more than half, it is a mistake.
But if you are doing salt supports, in terms of the work you do with acupuncture, it would just be to relieve the stress of the area, but it won't actually get rid altogether. It'll be a lifelong issue. That's what I mean.
With the shoe support and acupuncture, it was much better. Combination is much better. Okay. We are going to move forward for throat pain. Now, we are talking about internal pain, not structure pain. First is throat pain, and then we have chest pain, abdominal pain, dysmenorrhea, for example. We take the few the pain due to internal disorders as example. Throat pain For example, some people have throat pain, some people have eye pain, some people have ear pain, doesn't matter. We take throat pain as an example. So you will see our treatment difference is at the place where we can lead the treatment to the place where have people complain. If people have a throat pain, we give some point, lead to the throat. If people have an eye pain, we lead to the eye. If people have an ear pain, we lead to the ear, right? Rest is the same. Rest is the same. If you wind heat, wind cold, wind damp, liver chi stagnation, liver fire, it's all treatment same. Let's have a look. What are the common causes to cause the throat pain? External invasion is due to wind cold, wind deep heat, and wind toxic heat. It's acute. That people complain that for a couple of days, couple of weeks, they have acute pain. Of course, wind cold have runny nose, white discharge, cough. Wind heat, red tongue, yellow greasy coating, and also, for example, red throat, swelling throat, fever. Toxic heat can be high fever, tonsillitis, pus formation. Of course, throat have burning because there is a damage of the wind heat, wind cold, wind damp, damage to the meridians, damage to the tissue of the throat. What are you going to do? Treat the external invasion and treat the throat pain. Because throat is the most important corridor from the lung, right? And therefore we have to choose mainly the points from the lung to relieve the throat pain. But of course, we have to choose the point first to relieve the external invasion. External invasion, no matter it is external wind cold, wind heat, wind damp, we have to relieve that. For example, larger than 4, 5, lung 7, gallbladder 20. Reducing with moxa. With moxa. Until now, we did not clear the heat. We did not remove toxin. So if it's wind heat, we add lung 2, lung 2, lung 10. Toxic heat, lung 1, lung 11, GB 14. It's enough. All reducing. All reducing. Is that enough? No. No. We have to go now, move to the place where throat pain. For throat pain, we have to use some points going to the throat, to lead to the place we have throat complaint, for instance. Renmai 22, Renmai 23, stomach 9, stomach 9. Lung 6. Here is the even. Even method. This is the very important treatment to lead the effect to the throat pain. Without this step, this is for step 4, all kinds of types. It is impossible to treat the throat pain. So this treatment for external invasion plus the local treatment, this is for throat pain. Working faster, especially for children. If there's a lot of phlegm, for example, throat infection, because it's corridor of qi. Lung qi is dispersing the water as well. So if the phlegm is over there, okay, then stomach 40. Metro reducing. Okay, very clear. If people who have a fire from the lung and stomach, high fever, cough, phlegm, bronchitis, yellow phlegm, or people have vomiting, high fever, headache, means also can be due to external infections, invasions, or heat accumulation, constipation, high fever, and etc. Mostly the heat is too much accumulated. Heat from the lung going to throat, from stomach going to throat. So phlegm is yellow and sticky. So we use hyperactivity, lung 1, blood 13, GB, okay, 12, GB 12, stomach 42, stomach 44, spleen 6, reducing. To clear the fire from, this is from the lung, and this is clear the fire from stomach. Okay. Also the local points here. Don't forget the local points. The local points must be important. Suppose, for example, people who have not the throat pain, but the main complaint of nose pain. Nose pain, right? The nose. Burn sensation, burst, hot, heat, opening, the membranes is damaging, redness are so painful. I have cough. Okay, I know that is cough. I'm not treated, but my nose so painful. Not throat pain. Okay, here changes. Rest is here is same, but here changes. For example, for nose pain, we use, for example, large intestine 4, large intestine 11, large intestine 20, stomach 3. Okay. In tongue. Reducing. You see? Okay, that is the situation for the nose pain. Okay. Another child has a fever, throat pain, bronchitis, cough, same like this. But the child complained of what? Complained ear pain. The ear blocked. So then you use a pointer to relieve the pain in the ear. For example, Smart is 19, Goblet 2, Triple 17, goblet 20, stomach 7. Reducing. Right? Good. Very good. So the last touch is important. Okay. You want to serve your patient with a bowl of food. You cooked something in your kitchen, but you have to bring to your guests. This is the way. Qi stagnation. Qi stagnation is mostly from the liver because liver channel also pass through throat. Throat pain, nothing to be found. Examination showed everything is normal. But the worst during the stress, they're feeling something blocked in the throat. And also tensed, spasm feeling. So we use 19-4, liver 3, liver 14, pericardium 6, goblet 20. Okay. Spleen 6, heart 3, 18. You see, so they're a wonderful combination. Without this treatment, you only want to use a local treatment. Local treatment, for example, it is impossible. Impossible. Right? Okay. So costly treatment, local treatment, and also sun calming treatment. The sun calming treatment is already here, already there. Heart 3, for example. Okay. Pericardium 6 is already sun calming. Goblet 20 already sun. Goblet 3. Rest is qi circulation. Phlegm accumulation, especially phlegm heat. That feeling pain, blocked feeling in the throat with phlegm, that they cannot expect it out, cannot swallow up, but phlegm is annoying. Heaviness, obesity, pressure in the chest, dizziness, etc. So what are we going to do? Phlegm resolving. Resolving. Plus the local point we listed already. Okay. Next is the yin deficiency. Yin deficiency is for those people who have hot flashes, burning sensation in the throat, tiredness, dryness in the throat, poor vision, thirsty, weakness, etc. So it's yin deficiency of the lung and the kidney. So we tonify the kidney, lung 5, lung 1, bladder 13, okay, and lung 8, lung 9, spleen 6, kidney 3, kidney 6, kidney 7, and kidney 10. Tonifying. Okay. Meanwhile, use the points as listed above. Here is obviously to nourish the yin of the kidney. And the other one is to reduce the tonify the yin of the lung. The lung. If people have only the lung yin deficiency, kidney yin should not tonify so much. Or other way around, if there is only severe kidney deficiency, lung yin is not so deficiency, only use 1 or 2 points for the lung. But no, mostly they affect each other. When is the mother, lung is the mother, kidney is the son. Kidney is son. So don't forget to add points, always the local points treatment, because this treatment is going to lead the effect of treatment to the affected area, to the affected areas. That's for the throat pain. So now you have learned also for ear pain, for the nose pain, for the somewhere else pain, right? Now chest pain. Chest pain is the same. Only difference is where location is not in the throat, but it's in the chest. So if you use the points here, here, you use those kind of points for chest pain, nonsense. No effect, not at all. You use chi circulation, blood circulation, this and that, it's okay. They can be helpful for maybe 30%. But don't forget why, because they only have a 30% effect of treatment, because you did not lead your treatment to the chest. So the only treatment we are going to deal with it, rest is same, is here. Instead of going to throat, we are going to the chest. Chest, which way going to chest? Okay. To bring the effect. Okay. Pericardium 6 plus spleen 4 to open the chest, yin way. Lung 7 plus kidney 6. Number 1. Number 2 is causative treatment. Causative treatment. If chi stagnation, the blood stagnation, phlegm obstruction, yang obstruction is the same. Chi stagnation you have already learned, large lesson 4, liver 3, liver kidney DDD is okay. Blood stagnation we do not talk. We just also we mentioned the large lesson 4, liver 3, spleen 6, heart 3, lung 9, blood 17. It's all for everyone same. For heart yang obstruction, phlegm, of course, then you have to do something. Phlegm 40, spleen 9, blood 13, blood 15, HG 11. Okay. Obstructing the yang in chest. Okay, this is the second step. So First step, second step. Now the third step is local treatment. So, for example, you have to use some, for example, kidney 23, renal 17, 24 also, kidney 24. 14. Those are all the reducing. They're all the so-called local treatment. This is the last touch, a final touch, magical touch. It brings the effect immediately going to chest. But this is already to open the chest. But this is just to regulate the chest. But this is the most important. However, this is the last touch. Last touch.
Professor San, by the local treatment, also gallbladder 22?
Yes, sure. It's sure. They lead all to the local areas. Yeah, local areas. Okay. Not that many. 3, 4, 5 is sufficient. 3, 4, 5 is sufficient. All right. Good. So this is the things. Okay. Now it makes you much easier and clear in the mind. To deal with treatment, we should always think, what is the cause? What is the cause? Someone have a pain due to emotion, it's chi stagnation or blood stagnation, or due to flame, or due to heat, or due to damp, etc. Then we have treated cause. Then we have to treat the local areas. If people come exactly same mechanism, they come for the low back, low abdominal pain. The treatment is again different. It's again different. So we take a break for 10 minutes. We will be back at 3:30. Okay, we'll continue. Next is epigastric pain and abdominal pain and dysmenorrhea. Okay, take a break, please. Okay.
When you mention qi, you sometimes differentiate qi stagnation and blood stagnation. And sometimes you say qi and blood stagnation. It's not very clear in my mind. On the whole, when you've got stagnation, the qi and shui will be together. But you sometimes, if it might just be qi stagnation, is that basically what you're saying?
Good. They are different. They are different. Strictly speaking, qi stagnation is only showing pain with distending characters. Blood stagnation is the pain with the characteristics of a stabbing pain with a fixed location. However, because qi is leading to qi circulation, could lead to the blood circulation. In some cases, qi blood stagnation can be coexist. It will not say that 50-50. 50% of qi stagnation, 50% of blood stagnation. But always there is a certain percentage more belong to the qi stagnation or belong to the blood stagnation. Qi stagnation, if during the lessons, we try to speak as typical as possible to make the audience very clear with each individual symptoms. But in practice, sometimes it's a mixture. However, from the small details, you have to find out is majority of complaints due to qi stagnation, or majority of complaints is due to blood stagnation. Then you have to make this balance. But in slight cases, it can be only chi stagnation or only blood stagnation. For example, you are falling down during operation. And this is a typical blood stagnation. They will not show, oh, I have swollen, I have this moving pain, always fixed location, stabbing pain, local redness, local purplish. But sometimes after operation, for example, appendicitis, gastric operation or uterus operation, people have a swollen abdomen beside next to the stabbing pain. Therefore, as long as there's chi stagnation, you have to make chi circulation. As long as there's blood circulation, blood stagnation, you have to make blood stagnation, circulation. The percentage of your intention is not decided by you. It's determined by the clinical symptoms. Okay.
Sorry, just a small clarification. You said chi stagnation is pain with distension, is that right?
Yes, yes. Sometimes moving in nature, aggravated by emotions. Not worse during the night, but blood stagnation is on the contrary. Fixed location, worse at night, and is not immediately influenced by the emotions. Clear? A little bit more clear. Okay. Now we are going to move easier and much more easier for the epigastrial pain. It can be serious, epigastrial pain, serious, due to, in classic medicine, due to Helicobacter, due to esophagus cancer, stomach cancer, ulceration, prolapse of the stomach, gastritis, anything can happen. But TCM cannot look at through the stomach because we don't have a gastroscope. And also the classical diagnosis will not determine our TCM diagnosis. So we will discuss the epigastrial pain, and according to TCM, we classified epigastrial pain into two groups. One is due to acute, caused by external invasion. Another is due to chronic cases due to internal disorders. For example, if it's due to external invasion, most it can be wind cold, wind damp, wind heat. How come that external invasion also can cause epigastrial pain? Because the pathogenic factors could be swallowed together with our food, or the food is contaminated. So it has wind heat, wind damp, wind cold. Okay. In this case, situation happens suddenly, acute, with external symptoms. Majority of the cause is due to internal disorders, due to chi stagnation. Especially the chi stagnation from the liver and stomach, due to blood stagnation, due to damp accumulation, due to excessive heat in the stomach, and due to stomach ink deficiency. Infectious. due to and also sometimes due to the other factors. For example, due to some cases is that due to prolonged damp heat. Damp heat accumulation. No matter what, so this is internal cause. So of course, the difference is quite big between the external inflammation and the internal disorders. They don't have external symptoms. They have been in the body for long times, months and years. Yeah, especially that you can see that, for example, chi stagnation is with emotion is worse. Blood stagnation is at night worse. Fixed location. Damp accumulation is heaviness. Excessive heat is burn sensation. Stomach insufficiency is dryness, heat sensation. And damp heat is nausea, vomiting, burn sensation. No matter it is chi stagnation in the stomach or blood stagnation in the stomach or somewhere else, the treatment is the same. The treatment is the same. So chi stagnation is also larger than 4, liver 3, liver 14, pericardium 6, okay, and also 12. Blood stagnation is larger than 4, liver 3, okay, spleen 6, bladder 17, 9, all reducing. Damp accumulation to relieve the damp. If the heat is there, we have to clean heat. Insufficiency, we have to nourish. Spleen 6, kidney 3, bladder 20, bladder 21. 25. And if there's excessive heat, a big appetite, burn sensation, heat in the stomach, bad smell from stomach, constipation, nervous, larger than 4, larger than 11, stomach 40. Stomach 44, stomach 42, 6, reducing, all reducing, except only one is tonifying, rest is all reducing. Here is we have used the tonifying method. That is all we use to reduce method. But if we stop here, it is very logical. It's logical to clear heat, to clear damp, clear blood stagnation, etc., etc., to smooth emotion. But never stop here. This is first step. First step, step 1. Step 2 is that we have to use to make some pain better. For example, stomach 40. It is the low point. It's a low point. Stomach 36, shift cleft point. Okay. Stomach 25. Stomach 21. Okay. Okay. To relieve the pain, stomach 36. Okay. To relieve the pain, bring down to descend the stomach chi. Relieve the stomach pain. Okay, descend chi. Descend the stomach chi. This is the last touch. Last touch. But this is a basic treatment. Basic treatment. Now you are very logical to deal with the differentiation, to clear and to eliminate the causative factors. And finally, you have to use points to descend stomach chi. Why? Because the stomach chi must move downwards to perform its physiological functions. And meanwhile, this is stomach 40 is a low point. Stomach 34 is a Shikha point. These 2 points are very strong enough to relieve the pain of the stomach. They're not going to relieve the abdominal pain, but they relieve stomach pain, including the esophagus. Stomach 21 is local points. Stomach 36 is the C points, working deeply in the large intestine, in the stomach. So all these 4 points, together with the above points, they cannot be worse. But if people who have, say, still so long history with stomach complaint, then you just, of course, for example, 6, regulating. If necessary, you can still add extra point stomach 21, blood 21 for the stomach situation. This is also a strong combination to relieve the stomach complaint. If it's a deficiency, you tonify it. But in most cases, it's excessive, so you reduce it. And also, of course, you see here points, they are very interesting. This is kind of a situation I have mentioned, is a pain relieving, almost the same. But if the pain is severe, you use some calming points, actually make some pain diminishing, tolerating of the pain. If necessary, you can use some around the stomach 21, around the epigastric region, you could find some local ashi points, also possible. So you have, usually speaking, you can all very good. In severe cases, they have you try to descend stomach chi, but still people feel blocked chi in the stomach. You can opening points. Opening point is pericardial 6 plus spleen 4. Okay. If it is excess, you can use hollow points, but you have a different possibility to use. But mostly it is enough, more than enough. We have never talked about the points, ear points, but ear points is the symptomatic treatment. Consists of 2 parts. One is sun regulation to sedate pain. Another is location indication. For example, this is stomach pain. You can use Sunmen subcortex, and the cream, for example. And also you can use the local, the local area. For example, stomach is most important. And also you can use, if it's due to emotion, you can use the liver. If it's due to the, for example, flame diameter, you can use the spleen, sanjiao. If it's due to external invasion, for example, you can use the lung, etc. So number 1, number 2 steps here are most important. Most important. This is for epigastric pain. Seems complicated, and then they say, for example, they have a helicobacterial infections. And after 1 treatment with antibiotics, 10 days antibiotics, they still found the bacteria. So they don't want to have take second dosage, but there must be some reasons existing why antibiotics don't work properly. So TCM going to try to make a differentiation and also find out what is the chief cause and regulate the etiology and pathology. This is for epigastric pain. For epigastric pain. Now also it's the same for hypochondrial pain, but hypochondrial pain now the location is not in the stomach, it's the liver gallbladder. So what all we have to change is here. Is here. Here is a place to change. For stomach pain, epigastric pain, we have to descend stomach qi, regulate stomach, promote digestion. But for hypochondrial pain, exactly same. That we remain same treatment for etiology and pathology, but here we have to treat. The main treatment here difference is we remove this out. We remove out. We change here. So okay. For example, liver 14, gallbladder 22. Okay. Liver 13. Okay. Liver 13. Okay. Triple 5 plus gallbladder 41. This is the place plus Ashi point. For example, people who have an intercostal neuralgia, hip exhaust, very painful, or sequela of the hip exhaust. People come here for hypochondrial pain, or people have gallbladder stones, who have a cancer, post-operative pain, liver, gallbladder, etc. So here is the key treatment to lead the treatment, to guide the treatment, to have effectiveness at the place. So if people have a liver qi stagnation, liver blood stagnation, it's same treatment. But you have to go to lead to the liver effect. For example, there's a liver qi stagnation. You have to lead to the liver. For example, liver 3. Okay. Liver 5. Okay. Large 4. Pericard 6. Okay. Gallbladder 20. Hard 3. Bladder 18. Reducing method. For qi stagnation. For liver blood stagnation, we can use qi circulation plus some blood stagnation, spleen 6, spleen 10, bladder 17, 3, 18, okay, 8, reducing. Good. For example, liver cirrhosis, early situation with liver cancer, etc. Damp heat, hepatitis, liver cirrhosis, gallbladder stones, damp heat. So gallbladder 34, gallbladder 40, and also gallbladder 36, gallbladder 37 is shaker point, low point, and also spleen 6, spleen 9, last 11. Okay. Gallbladder 4, okay, already. Spleen 6, reducing. Okay. And the blood deficiency. Chi deficiency, blood deficiency, especially is that people have a blood deficiency due to overworking, age. So spleen 6.
Would gout be considered an accumulation of damp heat, or is that more?
Stone formation, gallbladder stone,
Okay.
or gallbladder inflammation, hepatitis happens a lot. So you have treated, then they can also discharge the stones. Yin deficiency, people during the menopause, liver sensitivity, night sweating, liver pain. We have to nourish the yin. Okay. So this is more nourish the yin, tonifying. So majority you can see are due to excessive. Mostly is due to emotions, but sometimes it's due to deficiency. Blood is insufficient or yin deficiency. In that case, we nourish it. So if we only nourish it without going to lead to the certain places to open blockage, and they will be still painful, because a lot of points should be added, yuan point, low point, Shikha point, to relieve pain, plus induce the treatment go to certain areas. Now, for example, people have colitis, who has complained of 61 chrome, not from the liver, but the damp heat where? Damp heat in the large intestine, not in the gallbladder. Can we use same points? No. Then it is, we have to mainly use the damp heat for the large intestine, for example. Damp heat. Okay, large intestine. In this case, people have a diarrhea, blood in the stools, burning sensation and illness. fever, fresh red color of blood. So it's damp heat in the large intestine. So here, we still have to clean the damp heat, spleen 6, spleen 9, stomach 40, the mat 12, right? But now we have to clean the large intestine. Stomach 25, bladder 25. Okay, GB3. GB3, reducing. Okay. Meanwhile, we have to clean the going to the place where have people have abdominal pain. 28, stomach 29, reducing. Okay, so this is for sixth form Crohn disease, such as okay. Sixth form Crohn. Okay, sixth form Crohn.
Could I ask something, Professor?
Yes, okay.
Speaking of my own experience, when I was 13 years
What?
old.
What?
Can you hear me?
Yes, okay.
Okay. Speaking of my own experience, at the age of 13, I got B syndrome. I was living in tropic Suriname. And after about 4 or 5 years, I discovered that it all came from Crohn disease. So according to Western diagnosis, everything had to do with my intestines, so how can I explain this, the connection?
Okay. Crohn disease, we have different types. Light type is that liver attacking the large intestine, liver disharmony. Because Crohn disease is also autoimmune disease. That most people are too much stressful, too much emotions. And these emotions can be deep in the soul. Even that the emotion was formed during the fetus in the uterus from the mother. Or they have this kind of emotion afterwards. But anyway, this emotion is quite deep. That's why I call some disturbance of immune system. Now, light case is liver qi stagnation. So regulate liver, support the liver, harmonize large intestine. Okay. But gradually, you can develop the damp heat accumulate in the large intestine, ulcers, vein damage. So people start to have discharge of blood, fresh blood, pus, and abdominal pain, etc. This case is showing that if there's damp heat in the large intestine, we have to clean the damp heat. See, clean damp heat, regulate the large intestine, and sedate the pain step by step. Now you ask me question: how come that you have a Crohn disease and then developed the B syndromes, joint complaint? So due to this liver attacking large intestine or damp heat accumulation in the large intestine, structures, for example, your resistance is low, your internal organ has some troubles. So at this moment, the pathogenic factors take this advantage, start to invade your body, invade the body. There must be some external reasons existing at the same moment. So you have a mixture of external invasion together with internal disorders. So the internal disorders attract the external invasion. So I believe you have more damp problems, So that's why you attracted the the external damp invasion. Do you have a phlegm in the stools?
Yes.
Yes,
Yeah.
you see, you are not going to only have the liver stagnation. No, you must have some phlegm. That's why external damp will take this advantage to invade your body.
Yeah, it was mostly the small intestine, and in the end, 7 meters were removed of my small intestine.
Yes. Of course, you have been waiting for a long time without TCM support. If somebody next to you who is qualified, who is experienced, and they will help you stop deterioration, because you let it develop, and then you have low resistance, then external window cold damp take place. I believe you have a rheumatoid arthritis, right? Not
Yes.
rheumatoid, right? Oh, you see. Rheumatoid, because rheumatoid arthritis, Crohn's disease, they're same family. They all belong to the autoimmune disease. Patention, you will have a patention for thyroid, Hashimoto disease, and also other disease for patention. But one key point, pay attention for damp, pay attention for your liver. Your disease is in the large intestine, but your origin is from your liver. I don't dare to say that you are unhappy, but emotionally liver is blocked. Try to discover, identify why your liver is blocked. Most is your liver chi stagnation is there. Probably you are unhappy. You have encountered many emotional difficulties. I believe. Is that true? How old are you?
I am a very positive person, but I am
Good.
very sensitive.
But now question. When you was in the abdomen from your mama, your mother had a lot of emotions.
She did.
See?
Yeah.
Yes. Did. You see. Your mother is the cause of this chi stagnation. You see? Luckily that you are happy, but your emotions are too deep. You're too deep. If you only treat large intestine damp, no. We have to work for you liver to prevent aggravation of your future degeneration, deterioration. Yeah. Pay attention. Now you have studied TCM. It's not a coincidence. It's destiny that the God won't help you because you cannot decide when you was in the abdomen from mother. Okay. Just not by coincidence. It must be. It's like that. Okay. Try to work on your emotions.
Okay. Thank you.
Professor.
Yes.
Can we, in that case, to the formula you gave us, can we add more liver?
But here liver is already there.
It doesn't seem like there's a lot of for Crohn's disease. I mean, for
Crohn's disease. No. Okay. Good. Yeah.
Because the only liver point I saw was spleen 6.
Where it means this one? This one?
Yeah.
Okay. At this moment, liver is not the main problem. It's the damp heat, burning sensation, anus, pus formation, blood, abdominal pain. Is the damp heat. It's already one step further. So you can add, but that's not the main treatment.
Okay.
Because there's no liver chi stagnation. If she or somebody say, yes, I'm still very angry, I'm depressive, I'm unhappy, of course, it is welcome to add some liver circulating points.
Yeah, I'm just wondering because Crohn's disease, it does seem like a modern malady. I know quite a few people who suffer from it. And so you said it's the liver that impinges on the intestine.
In the beginning, but end, there's damage. There's membranes damage. There's a series. That's why they have cut. Of course, emotions played a very important role to make it stabilize or to make it deterioration. It's of course you add liver point, 1 or 2 points, it is plus point. Plus point. Very interesting, very interesting. Some people have, do you know, irritable bowel syndrome? EBS.
Yeah.
But the EBS is not so far as the Crohn's disease. Mostly is liver attacking the large intestine, liver attacking the spleen. Nervous, irritable. When they are nervous, they start to go to toilet, abdominal cramp, emotional, depressive, etc. So working most for the liver. Regulated spleen also. To have support spleen, for example, spleen 3, spleen 6, bladder 20, etc. 25. Good. Okay. Now is the, I think this interesting is that abdominal pain. Abdominal pain is, I believe, is same like the hypochondrial pain. Nothing else. The treatment of hypochondrial pain is working on the situation of the hypochondrial region. But abdominal pain, don't forget, we have to work like Crohn's disease, working on these points. Hey, stomach 25, stomach, you see, stomach 25, I show you. Stomach 28, stomach 29 are the key points for abdominal pain, remember. So besides differentiation, syndrome differentiation, these 3 points can be what we call the guiding points to lead the treatment to the abdomen. Meanwhile, another situation is, another point is, for example, spleen 8. So we have 4 points can lead to the place. Rest is same. Rest treatment is same. No special difference. A cold invasion, okay. Latin 4, lung 7, triple 5, this, that. With moxa, with this. Damp cold, okay, same. We eliminate damp, adding spring triple 4, triple 6, spring 6, spring 9, etc. There's no special. If damp heat, excessive heat, damp heat, etc. Same like what we talked. No special. If it's toxic damp heat, people have high fever, we add for them. 14. Latin 11. Structures. Okay. If it's heat in the Latin nesting. Let's see. Okay. Nope. Reducing. For example, there's nothing special. Only here's changes. Okay. For damp cold, same as damp cold, no. Is cold mixed with damp. So, for example, Latin 4. Okay, here is Latin 4. lung 7, 2.5. Okay. Moxa. But then we use the same points above at triple bomb. I've told okay. The section. You see? So these 3 points plus above points here makes it possible that we are going to clean the damp and above clean the cold. And this cold damp is from external invasion. So this way we eliminate the damp, we eliminate the cold as well. Okay, so that's nothing special. Basic treatment must be the first priority. Plus the point going to the abdomen, to regulate the chi in the abdomen. That's the most important. What is interesting is we add one more topic, which is gynecological pain, dysmenorrhea. Dysmenorrhea is a case people can have endometriosis, cyst, dysfunction of ovarian. Any cases, any problems, due to functional or due to organic complaints. And we judge from the cycle. It cycle regularly. Too long, too short, we have to write down. Is blood loss too much or too little? What color, right? Most is dark color. Most is purplish color. Most is with clots. Most it is excessive. Light color, scanty, like blood loss is like water, diluted red water. So it means there's a deficiency. And also we have to find out, is this painful menstruation only at the front of the abdomen, of the low back, or both sides? So mostly we don't forget, when we regulate the pain, not same like the abdominal pain, we use the points like here, right? Now, okay, this will not help for the dysmenorrhea because this is regulating large intestine, spleen, stomach, the corridor of food. But dysmenorrhea is a place where have a problem of the uterus. We have to regulate the uterus. So chi stagnation, blood stagnation, cold damp heat, no matter what cause. You say, hey, you have chi stagnation due to liver stagnation. So if we are going to use a stomach 25, stomach 28, stomach 29, will not work. He is going to the where? Going to the 冲脉, 任脉, and 带脉. 3 meridians. These 3 extra meridians are closely related with the uterus. Which points are going to spleen 4? So, okay, you are going to use first step, spleen 4, in combination with pericardic 6. You are going to use this is going to open the 冲脉, regulate the 冲脉. We are going to use the points, you use lung 7, together with the kidney 6. is with the 人脉. We use gallbladder 41 and tubulum 5 is going to use dimer. I told you dimer is not that often used. Is compared to the first two, almost every cases you are going to use as a first priority. Okay, first, dimer can be optional in addition. When people have too much leukorrhea, or people have too much, for example, history of miscarriage, or they are working with infertility treatment with dysmenorrhea, then you can add. But this is not an obligation. Must be there, not always. In this way, it will lead you treatment immediately going to the uterus. If you miss these two, your treatment will not enter to the uterus. Because uterus is a unique tissue. It is one extraordinary meridian, extraordinary full organ. It is related with the liver, spleen, kidney, etc. However, this tissue, this full organ, has its own physiology and pathology. But if you are using this point by liver 3, liver 4, stomach 4, lateral 4, liver 14, and this and that for chistocytosis, it immediately leads to the uterus. Meanwhile, for pain, it's so first treatment is leading. Second is basic treatment. The fourth, I take this, maybe make it clear. Fourth is that with pain treatment. Pain treatment usually including sun, of course, number 1. But not enough. We use spleen 8, kidney, okay, 4, kidney 5. So these are very important steps. So for dysmenorrhea. Okay. Not only sun. Sun is for emotionally, which cause the pain, joint pain, body pain. But this gynecological pain, sun is not enough. So here is very clear that we have discussed the opening point of the 冲脉, 人脉. And then causative treatment, qi circulation, blood circulation, kidney tonification, blood tonification, then heat clearing, and this is not special. To clear damp heat in the intestine or clear damp heat in the uterus, blood is the same. But you have to lead the treatment going to happen in the uterus. Therefore, without treatment here, you will fail. Because you cannot go to the 人脉, 督脉. If it's a damp heat, you have to add damp heat.
Sorry, Professor, because last month we did a dysmenorrhea course with Dr. Wang, and I didn't have the impression that all of the formulas would have both the 冲脉and the 人脉. They would have one or the other, but from what I understand from your lecture, you need both. Is that correct?
It's better.
Okay.
Better, stronger. If you miss this 冲脉人脉, it's not enough. Because for ladies, 冲脉人脉 are important. For men, no, not necessarily 冲脉. Not 冲脉. But 冲脉 also important, not so extremely important, because 冲脉, how do you know judge a man 冲脉is working well or not good? Do you know? From their mustache. Because people, men, they don't have menstruation. All the blood, all the gene from 冲脉they collected, going to nourish the beard. So a man and boy have a little hair, they have a gene not so strong, the blood not so strong. A man with a strong beard, good distribution, and beautiful, the gene is very strong. For ladies, you can see, I say, hey, you have a regretted menstruation, you have a painful menstruation. How do you know? You never asked me. I say, I judge from your hair because you have too much hair on the mustache. For ladies, may not, because they have mainly blood needed to nourish the uterus. But now they come to the hair. So lady have a lot of hair. For example, they have a polio ovarian cyst syndromes. So this can be something wrong, 冲脉 disturbance due to chi blood stagnation or due to blood stagnation. Good. So anyway, now you understood. For treatment of the joint pain, shoulder pain, neck pain, elbow pain, hip pain, you need treatment of causative treatment. You need syndrome differentiation, and also you need channel differentiation. You have to add some one point, low point, Shikla point to harmonize. You also have to add some local points to guide to the shoulder, neck, hip, right? That is for the pain from the body. But then for internal pain, you also have to do the same way as the treatment for the joint pain, that you have to make a syndrome differentiation to find out the causative factors to treat it, number one. Second is that you have to treat it, make a differentiation of the channels. And then thirdly, you have to use some sun calming points. But also you have to lead the treatment into certain places, to the throat, to the ear, to the nose, to the face, to the chest, to the hypochondrial region, to the abdomen, to the genital, to here and to there. Right?
Professor? Professor?
Yes.
One question again about the order of the needles. So would you first do the causative, like the general needles, and then leading to the
no, that is syndrome distribution. Channel distribution. Channel, to find which channel.
Okay, and then you end with the needles that lead to the
yes.
Okay.
Okay.
Yeah.
Okay. Yeah. Good. And then also don't forget with sun regulation for severe pain. For severe pain, sun regulation or corresponding places you can add, or you can all add coronal point selection, like that. Now you are clear.
And the Shen regulation, you would finalize it with that, or you would start?
For severe cases, we use the sun. People sleeping, restlessness, nervous, agitation, then you add sun. Finally, also. Or if you want for the first, also it's okay. It's also. They will not help so much for the effect of a total treatment. It is also a kind of a symptomatic treatment. Okay.
Thank you.
Please.
Sorry, for the etiology, have we gone through it or is it as above?
Etiology of what?
Of dysmenorrhea as
It's the
G-section.
same. She's
Same as above? As
Huh?
in, it's the same as the.
Yes,
as
there's
sun?
no difference, no difference, no
Okay.
difference at all. I will spend about 10-15 minutes about B syndromes. And why? Why I want to spend extra efforts to explain B syndromes. Indeed, you have studied how to treat shoulder pain, neck pain, elbow pain, hip pain. But they're all individuals. But B syndromes, no. It come together. They have shoulder pain, neck pain, hip pain, elbow pain, all together. Where are you going to start? How can patient help patient with so much pain? Because it's rheumatic, it's rheumatoid, it is arthrosis. Yeah. Now we are going to talk the theories. So you understand firmly what's wrong with the people with B syndromes. Is that so serious? Indeed, there's no treatment in classical medicine. They maybe give corticosteroids, levostraxate is it's kind of a small chemotherapy. They give sedatives, etc. Now let's look how TCM analyzes it. First of all, it is called feng shi. Feng shi means that it's wind damp. In this way, it means the main cause is wind and damp. Pay attention, wind damp. But the feng shi is a normal people is name it, but academically they call it 避震. 避震, it means blockage. What is the exact meaning of blockage? Means blockage of the qi and blood where? In the meridians. In the different tissues, but mainly in the meridians, but also including different tissues. These tissues mostly is not organ tissues. And it is due to the invasion of wind, cold, damp, pay attention, which make blockage of the qi and blood in the meridians or some tissues, leading to the pain, pay attention, numbness, impairment of the movement of the joints of the body. So there is a group of symptoms, that's why called syndromes. It's not called B. B means blockage. Due to this blockage, it causes a group of symptoms. That's the first priority. You have to understand. Second thing that you have to understand is that it is B syndromes is very complicated. It is a kind of rheuma, but it's more than rheumatic complaint. It is divided into 3 levels. Pay attention. So we know the clinical symptoms is pain, numbness, movement, damage. Secondly, is that it is divided into 3 levels, 3 types. One type is a superficial type. It means that the B syndromes happened superficially in the beginning stage. But afterwards, it moves to the second stage, going to the tissue stage. I'm going to explain. The thirdly is finally life-threatened, which is going to the internal stage. Like I mentioned, if it's due to rheumatic heart disease, it is terrible. It is fatal. It is dangerous. So let's look at what are the most resemble disease in classical medicine. It is related with rheumatic complaint, including rheumatoid rheumatic disease. but also include a lot of connective tissue rheumatism, for example, rheumatoid, like autoimmune disease. Also including nerve pain. MS, for example, people can have, also can be partially included in the B syndromes. Syndrome, Raynaud syndromes also belong to the B syndromes. Never mind, we don't need to say that B syndromes exactly as the rheumatic or rheumatoid disease in West Western. Never mind, as long as people have a complaint, we call it B syndromes. Let's look at the etiology. What are the causes? Okay, the cause is very simple. It's due to invasion of wind, cold, damp, based on the Zhen qi, Wei qi, weakness. Understand? So that is very important procedures to tell us. Living in Benelux, it's very humid, cold, windy. But not everybody is sick. Why? Because Xie qi is always there, but Zhen qi is always strong. So young people don't have it. Strong people don't have it. People is well cared, they don't have it. Only Wei qi is weak. Zhen qi is weak. Due to emotion, due to weakness, due to age, due to poor health care, the pathogenic factors take advantage of it. Scar going to invade the body. So finally, you can see the extreme importance of Wei qi. Wei qi, Zhen qi, emotion qi is important to against the pathogenic factor. What are the pathogenic factors? Is wind cold or wind damp? No. It is 3 pathogenic factors at the same moment. Wind, cold, damp. Not wind, damp, heat. Wind, cold, damp. 3 pathogenic factors, not in equal proportion, but they must be there together. Must be there together. Wind is young, tiny young pathogenic factors. Cold and damp is yin pathogenic factors. So 3 pathogenic factors, among 3 pathogenic factors, 2 are very cold, 1 little young, not strong enough. So the wind makes the skin pores open, and then cold damp come to the body, make qi blood stagnation, obstruction, pain started. Understand? So indeed, we have to make treatment to rebalance the Zhen qi and take out the wind, cold, damp. But is it possible that we are going to have heat B? Yes. In which condition? I'm going to tell you. So external damp, wind, cold, damp is priority pathogenic factors, but internal weakness, qi blood deficiency, qi stagnation, emotion, constitution, disturbance. Anyway, your body is not in balance. That is the key cause. So mixture of Zhen qi weakness with external invasion. So young people here in Benelux don't have it because relative strong. But when wind, cold, damp invade the body, and if wind is predominant, we call it wind B. When cold is predominant, we call it cold B. When the damp is predominant, we call it damp B. The wind B is moving in nature, changing characters of the pain, sensitive to weather changes of the wind. Cold B is cold sensation, worse during the night, worse during the cold weather. Damp, if it's there, is heaviness, swelling, worse during the humid weather. So judging these 3 predominance, we can tell patients You pay attention for diet, sweet, don't eat. Pay attention to take a good warm clothes. Go to Spain in winter. Don't walk on the seaside because too much windy. So mainly we have 3 types of B syndromes. But on the other hand, we also have the heat B. Heat B. But how come? One condition or 2 conditions that when the cold damp B exists in the body for too long time, it will cause heat, will generate heat. Or the body has too much yang excess in the body. There's external wind cold damp invasion, but the body itself, it is too much yang. So the yang from the body will turn this external positive factor into the heat. So internal heat can also decide the heat. What symptoms of the heat be? Local redness. Local redness. For example, gout. Do you know gout? It's a kind of a uric acid increasing. It's a heat B. Why? Because people, they don't take care of their diet. They drink alcohol too much, eat meat too much. So finally, they have the heat B. So it's also B, but it's heat B. Okay. In any case, we have to stop the B syndromes and prevent B syndrome as early as possible. So here, we again emphasize, when the cold damp attacking at the same moment, not separately, at the same moment, probably wind is predominant or cold is dominant or damp is dominant, doesn't matter. Fine. We have different names for that. Wind B, cold B, damp B, heat B, right? Okay. Wind B happens, don't forget, mostly attacks diffuse joints, not one joint, up and down. However, mostly the B syndromes happens on the upper part of the body because it comes from externally. Seldom is due to internally, no, it's possible. It's externally, therefore, externally invasion cause a part of the body influence. Okay, so I think this is not easy, not difficult to understand. Fine. So here is that why people have the heat B is because body too much heat or too long duration of wind cold damp B. It's changed to the heat. Okay, changed to our body cannot be too cold, but also cannot be too heat. Heat can cause a lot of troubles, high blood pressure, nervousness, agitation, lack of patience. But heat also can change the cold into heat, to the heat. What's the reason that you can make troubles with the B syndromes emotions? Different emotions can cause lower down the zhenqi. Not only one emotion, too intensive, too long duration of emotions. You can cause the troubles of B syndromes because it's a slow down the qi circulation. And due to this qi stagnation in different organs, they can cause disturbance of 5 elements. For example, liver qi stagnation. If liver qi stagnation only stay in the liver, it's okay. It's isolated. It's not a problem. We can manage it. But the liver will attack the lung. The liver will make the heart fire. Liver will attack the large intestine. Liver will consume the kidney gene. Liver will attack the spleen, etc. Because this is a 5 element. It's moving. It's constantly turning. So it will make heart troubles, make spleen troubles, make this and make that. Emotion is actually a chief causative factors which lower down the resistant zhenqi. Okay. So pay attention for the different emotions to balance emotion. I don't say that you cannot have anger, you cannot have thinking, because we are human beings. We are not animals. Even animals could have some emotions. I mean, tolerate. Don't let it in the body for too long time. Okay, because your emotion is mostly congenitally inheritance from father, from mother, from grandmother, like this. But still, your personal experience is important. Your background, your study, your behavior, your husband, your children, and your position. Suppose you are the king, you become king. You're still angry, you are still nervous. No, you have to behave very well. Of course, your personal experience, study also can change your emotion, change your way of life, and of course, the environment, and also healthy condition, dietary. They're all important. If you don't eat well, you could have emotions, of course. If you live in stress, in the situation, is in the in work environment is too much stressful, you can't be emotional. Try to regulate as much as possible. Okay. So we have to take care of our Zhen Qi by studying well, by eat well, by rest well, to treat disease well. Anyway, to make a good health. Now, about how to deal with the B syndromes, I mentioned already. If people have B syndromes, they have a diffused joint influence, pain, right? Okay, so they can be worse by their diet, by their emotion, by their stress, etc. Nevertheless, the pain is the main complaint. Stiffness, deformity is the main complaint. So this main complaint is Qi plus stimulation. Okay, never mind. We are going to talk about the treatment. The treatment is not that simple. We have to decide it at what stage. It's not say, hey, give me points, Latin 4, Latin 7, Latin 7, level 3, it should be. No. We have to know which stage it is. First of all, it is at the superficial stages. Superficial stages, wing B, cold B, damp B. It's easy. Joint pain, shoulder pain, here pain, there pain. Then you have to eliminate wind, cold, damp, or sometimes eliminate the heat. But now we look at here, pay attention here at page, this page is that tissue B. Tissue B. Tissue B, if it's not controlled, it will come to the organ P, going to certain organs. Here is the connections. Vascular. Vascular B, we call is that people who have a syndrome Renault. This vascular B. Spot others. And people have a night cramp. This is vascular B. Tendon B is people who have the, for example, tennis elbow, golf elbow, carpal tunnel syndromes, Achilles space on staking. Muscle B can be scleroderma, MS. Skin B can be also mostly is scleroderma. Muscle B is MS. Scleroderma is for the skin B. Bone B is people who have rheumatoid arthritis. If the tissue B are not treated properly, they will develop into the bone, the organ B. For example, vascular B, not treated, they will become the heart B. The tendon B will come to the liver B. Tennis elbow will not develop into B syndromes usually because our body resistance is still strong. However, general body tendons inflammation, general body, not locally. If I work, I chop my furniture too much, I work too much in the garden, I have a tennis elbow, it will not cause the liver beat. However, if there's a general body tendon inflammation, general body, not cared, it will come to liver beat, right? So people who have a MS, for example, right? They will find it disturbed to impossible to eat, phlegm, diarrhea, muscle atrophy, and dying. Scleroderma, they will cause trouble with the lung. Bone B, they will cause a lot of trouble with the kidney, etc. I'm not going to talk about the vascular B because this is really impossible to be treated by acupuncture. You need herbal treatment and also surely Western medicine treatment. We discuss about the how to manage the tissue B. Okay, here is we're going to talk about the treatment. Okay, treatment. First is superficial. Superficial B. Superficial B, it has a wind, cold, damp, right? Okay. Generally speaking, we have discussed it. Wind superficial B is there. Most is different joints are involved. Shoulder, neck, finger, elbow, hip, everywhere. Don't worry. We still have to general treatment going to the large net 4, lung 7, triple 5, gallbladder 20. Okay, reducing. Wind is, for example, gallbladder 31, right? Okay, gallbladder 21. Cold, moxa. Damp, spleen 6, spleen 9, reducing. But are they enough to deal with all the pain? No, not enough, not enough. So what are we going to do? Go to the joint, go to the joint, especially going to the joint, triple 5. Because if we cannot go to shoulder, elbow, knee, we have the kidney, the hip, too much. It is impossible. So we have to a technique. Finally, we find a solution. This is going to Shaoyang channel. Shaoyang channel is going to as a networking system. It's going to net to cover all parts of the body. Without this one, you are not going to cover all the bodies. So this is a good way to cover the Shaoyang channel. Because Shaoyang channels, this is extremely important. In order to make the Zhenqi weak, the Zhenqi stronger, lung 7 plus kidney 6. One is for the networking, another is for support Zhenqi. Meanwhile, you can add stomach 36, spleen 6, kidney 3, tonifying. So wonderful. Now, such a simple treatment is going to cover wind, cold, damp. They are moving in good directions. That's good directions. And of course, and then some local treatment. They say, I especially come for shoulder as terrible. Okay, then I treat the local shoulder. They will never say, every exact same. No, they will tell you one place is the most important. One place is important. This is okay, I will show. Maybe I will send this afterwards to you because she asked to give this. Good. Local treatment. To select the most important painful place to be treated. This is for superficial B. How do we know it is still superficial? They're sent to weather changes, deformity, diffused joint complaint. When they move to the tissue B, tissue B is most important. At this moment, they are not to show very close relation with weather changes, but sometimes still weather changes can influence their pain. Tendon B. Tendon B. Tendon B is mostly chi blood stimulation. Okay, so large intestine 4, liver 3, pericardium 6, spleen 6, bladder 17, lung 9, heart 3. Tendon B plus gallbladder 34, going to the tendons. Going to the tendons. Without this point, forget about this. Forget about your intention. This tendon. And then going to the bones, bone B. We have to add bladder 11. Muscle B. Okay, spleen 3. Add spleen 3. Because spleen is responsible for muscles. Skin B. Number 7. Blood cell 13. GB. Tendon, bone, tissue, okay. Tendon, sense, vessel B. Good. Good. Vessel B. So you make some blood, chi blood circulation. Mostly pathogenic factors are still there. Okay. So it is depending on what kind of pathogenic factors are still there. You give treatment. Okay. And then you add some points going to especially to the tissue, lead the treatment going to the tissue. Suppose people have a really organ pain, then can you also treat it? Treatment is okay, possible, but don't expect that will be very good result. So in this way, you treat not only one joint, but you treat the whole body. You are not only going to eliminate pathogenic factors, but also you pay attention for the zhen qi. Because in other joint pain, in other internal pain, you never talk about the zhen qi. But here for B syndromes, you have to talk about zhen qi to support the zhen qi, to tonify the body. This is the way. You have to open. You have to open the networking because you want to cover the whole body. You are not going to treat individually. Oh, shoulder pain, neck pain, balls pain, finger pain. So maybe you can put 100 points. Not necessary. You only can choose the most painful places and then punctuate. Rest is you give treatment as elimination of pathogenic factors, support the zhen qi at the same moment, plus the local treatment. How wonderful it is. So TCM of B syndrome has its unique procedure of analysis, classifications, and also treatment. No worry, I will send this to her, and she will spread this to you. I believe that today we have discovered a lot of knowledge. It reflects the whole material you have studied in the last 1 or 2 years or 3 years. I hope that you have learned a lot and you can practice and test the TCM theories and also the lecture materials. Any questions, please, Kevin?
Before I forget, can I just ask you to also email me again the first document, because you put a lot of changes in it.
Yes, I will send you this again.
From yesterday, great.
Yes, okay, good. Any questions?
Yes, I have one question. Fibromyalgia, I don't know.
Fibromyalgia, yes, it's okay. Yes, okay. It's
so
muscle. It's muscle pain.
Okay, I was wondering.
Muscle pain. Yes, muscle pain. Fibromyalgia is typical muscle pain. It is due to external invasion. Some people bite by thick pathogenic factors invaded the body. But also pay attention people who have a vaccination, COVID-19 vaccination also belong to these B syndromes, general body pain, and also suffering from the B syndromes, autoimmune disease. Okay.
I do not completely understand that. You mean that the pathogen that is injected, that it may cause a B syndrome or always causes a B syndrome?
Might cause B syndromes. It's depending on the zhen qi. So somebody who are very weak, they can cause these B syndromes. Zhen qi. That's why we treat the zhen qi and also the xie qi at the same moment. B syndromes need a unique treatment. You see, this is the one we have to treat it, support the zhen qi. Without supporting zhen qi, B syndrome will get worse. Good. I believe that you have a very heavy weekend. You have learned a lot, and I appreciate your attention, participation, and the knowledge of TCM, and also your enthusiastic attitude for TCM, and for a person who are the fullness, but still love TCM so much, which is great to see and to feel. I hope that you will enjoy TCM study. And there's a book on B syndromes. I wrote it, I published it 30 years ago. But
sold out.
It's sold
My
out.
book is sold out
Yeah. How do you know? Yeah, sir. But if
because I try. I have this one.
yeah, but this is pain. This is pain. Wonderful. This
This one for B syndrome.
Oh, how did you get it? Hey,
I did.
how did you get it? Because it's very expensive to buy now. Oh,
Yeah.
very
I got
expensive
it.
to buy. Yeah. It
Yeah.
was in 1991, something like that. Of course, there's some herbs. And but the French version of a B syndrome is still available. French. Somebody who speak French probably and can read it. Okay. And where are you from? Share. Porche. Are you Pakistan?
Yeah, I'm originally from Israel, but I live in Holland, in Amsterdam.
You are from Israel. I see. I thought you are
Yeah.
from Pakistan. Okay, fine.
No,
Never mind.
could be.
Good. How's TCM situation in Israel?
It's a good question, but I'm not living in Israel for the last 15 years.
I understand. I see. But I believe that is also developing quite well. But in
Yes,
Israel,
it
we will
is.
not have so much B syndrome because the weather is different.
No,
You know, it's
B syndrome there.
Yeah, B syndrome. In Spain, they don't have so much B syndromes. Yeah, like that. Okay, thank you for coming to the lessons. I hope that you enjoy the lessons.
It was really great.
Very much.
Document. Enjoy your lessons
good
and
weekend.
take care. Thank you for coming. Bye-bye.
Thank you.
Thank you.
Bye.
Thank you so much.
Bye.
Bye.